said. I had the coolest microphone. Making sure you have enough staples for the day. Pretty cool.
Here. Martha Blue Thunder. Sherry Right Flank. Present. Pamela Kilsonwater. Here. Raymond Croeagle.
Here.
Sarah Iett. Donna Hallheimer.
Here. Sure. It's 15 total.
15 President. Keith, can you do invocation, please? Thank you.
Gabriel, então achei a registro. Mas o caso lá não o nem já vi, a gente já pode testar um pouco. Tá, não. É o caminho de canto com caso lá a gente vai. É que cansa de cara. Vai o tipo na gente com caso lá, o campo. Olha o cara com caso lá que tipo tipo. Cabeto com a carta no time canario que já com a ok. Caixo aí, tipo, tipo, aperto que ele caixo, chosa, me dá isso.
No slide, John?
Hey, ha, ya, hey, hey, ha, ya, hey, hey, ya, hey, ha, ya, hey, ya, hey, ya, he, hello. Hey, 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 ha, yo, hey, yo. Hey, ha, ya, hey, hey, yo. Hey, ha, yo, hey, yo. Hey, ha, yo, he, hello. Hey, 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 hoy. Honka, shela, ya, be, kawa, baha, kena. Oh, hey, honke, shni, lay, lo, ai yo kla te wa, o ya de ki ha ya, wei chi chang li da chang le cha mu lo yo, ai yo.
Here we have a request, a few that need to be, for today. Martha, she has a appointment and.
Alice needs to be excused. Any more excuses for today? Not, we need a motion to approve excuses. Pam, Steve, and then Cher. All in favor, approving excuses?
2, 3, 4, 5, 6, 7.
Online, Eileen?
Yes.
Bill?
Bill,
Bill, yes.
Neil,
Yes.
Dan.
Oh.
Micah,
Yes.
Donna,
Yes.
14,
opposed,
0,
not voting,
1.
motion carried. Online is, Stan,
Donna, Wayne, Eileen, Tennille, Bill, and Micah today. Next is we need the agenda approval. We have a task force. Is there anything else that needs to be added today? Now, we need a motion to approve. Approve the agenda. Steve? Motion by Steve. Second by Donna. Question by Cher. All in favor? Approving the agenda.
1, 2, 3, 4, 5, 6, 7.
Approve the agenda.
Online, Eileen?
Yes.
Bill?
Bill, yes.
Tennille?
Yes.
Stan?
Oh.
Micah?
Yes.
Donna?
Yes.
Dara?
Yes.
14,
Opposed?
0,
Not voting?
0.
Motion carried. Okay, we have the task force on the agenda today. Yesterday, just for the council, on Monday, yesterday, Monday, they asked me to, have a special meeting for the task force to go over what they needed to go over for today.
15, 0, 0.
And, Skyline and I had a meeting yesterday, and I think it went for quite a couple hours at least, and to
to
discuss.
discuss on what the recommendations are as far as the numbers going up for the COVID numbers going up. But, we'll start out with, Skylar, you want to come up and kind of give us a recap of your meeting yesterday?
Morning.
Morning, everybody. So we had a regular meeting yesterday. We normally have it on Mondays, but since that Monday was a holiday, so we had it yesterday. So there were some issues that we discussed, and one of them was the numbers, and unfortunately, the task force wasn't in favor of a shelter in place or any type of shutdown, and that the schools would continue to stay open due to our children suffering enough, education wise. Whole schools, Tubb County and St. Francis, they have a hybrid plan in place, and they have their own protocols. So that's pretty much what they have in place. So with that, we're gonna honor the schools, for them to continue to stay open for the children. And the numbers are going up. We're gonna have to continue to encourage people to have social distancing, practice, hand washing and sanitization with their hands. And, can you hear me? Was he able to hear me? Oh, okay. And so also the 10-day of isolation and quarantine, that really needs to still be enforced for, you know, how we can, this isn't even like our peak. This is just the beginning of it, so we need to was a question, was the curfew. As far as I'm concerned, we haven't lifted the curfew. You know, the task force to recommend it to be lifted or anything, so I think that's something that needs to be talked about, was the curfew.
I have a question. Skylar, you brought up quarantine. I do know that in the last meeting you had mentioned that the grocery carts were going fast.
Yep.
How are we doing with the current inventory of grocery carts?
So after last night, after the meeting, when we got done, because I think we almost met like till 5 o'clock. So after that, then I went to go see how things are going, and we just have like one box left of $100. And then the $200 were, I think we have like 40 or 52 left of that. So, you know, and I let Scott know that last night too, so we'll be discussing that with Scott. And like just now, and Dina probably can elaborate on that. She just informed me that we have 62 deliveries today.
Can I show you that?
Good, Chair.
Thank you. I'm going to screen share some data that is collected. I think it's important to look at some of the trends that we have been encountering. And the reason I wanted to share this data is because, well, I want to review 2020, and I know today we're talking about the possible shelter in place. On October 16th, the shelter in place during that time, our numbers peaked and then they dropped. To me, which proves that the shelter in place works, but once it was lifted, our numbers spiked again. And he ordered another shelter in place, let me see what day that's, was the 23rd. So right when the numbers dropped, he issued another shelter in place, the numbers spiked and slightly went down again. And then once the shelter in place was lifted, we continued to spike. So the reason I'm showing this data is because I just want to share, I mean, I was in favor of the shelter in place yesterday. I think I was the only one amongst 15. But this data shows that they do work. However, once they're lifted, we peak again. So I don't know if, I mean, it would have to be a continued shelter in place to keep our numbers down. So I don't know if it really makes sense to issue a shelter in place, but that's up to you guys from the data. And that's only two shelter in place orders that I was able to find in my email to do comparison to this data. This lower chart here are our numbers this year. They look a lot different because the top one is only from June to December. And then this one is the whole entire year. You can see that our trends in the summertime are very, very low. And in the winter time, and yesterday when IHS was here, they were talking about how flu season and people are inside, contained in their homes. everything goes up because of, I mean, flu, COVID, everything is just expected to increase because of contact with each other and people not being outdoors so much. So this doesn't include our numbers for this year, which would only be 1 month or half a month worth of data. But as you can see, our numbers are at the highest that they have been. So I just wanted to share that with you, to give you all the information that the task force has to know how to make your decision today, whatever that decision may be.
Councilor, may I ask you a question?
Yes,
Where did your data come from?
from Molina Richards.
Thank you.
Council, the last task force meeting we had, when Dr. Toby was
talking about the numbers spiking, he said that it would basically spike in the end of January and then start coming back down in February. That's what he had reported at the last task force meeting, so I'm hoping that happens. Again, we just have to decide if we want to do a shelter in place, continue with reservation-wide shelter in place, or continue on what we're doing as far as putting things on the air, educating, encouraging to get vaccinated, and those kind of things that need to happen. So, Lisa.
Good morning, Council Administration. Sherman, what do you recommend?
I was recommending that we do a reservation shelter in place, but the schools are something else that I talked to both the superintendents, and they both want to continue to do what they want with their protocols. They think it's not a good idea for the keep the kids out of school. So they're very recovering from the last one, and they really had a really bad effect on all the student body as far as the kids that are in school now. And it's just a matter of recovering from the last year as far as being in shelter in place. The only one we wouldn't have control over was St. Francis if we had to direct them to do something, but I think they're doing the right thing. But I would think that it'd probably be a good idea to do a shelter in place.
Last shelter in place we had was with the employees, the tribal programs, because they were getting too many positive in programs, so I thought maybe it would be a good idea to do a shelter in place, but come to find out that even our own employees don't like to stay home. And,
How strict are you gonna enforce that?
well, that's just
They're
it.
talking about border
Yep.
stops, and
So
then
then, like, when
CHR
CHR goes to a house, if somebody's called in that's positive at a residence, and they go to that residence and they're not there, is the police force gonna be able to go out and enforce our laws that we have in place to, fine them for not being quarantined? Are you gonna ensure that all happens during the shelter?
Well, shelter in place is basically for essential employees. Again, you know, it's gonna be the ones that are working, and run into a problem where now the tribe programs, they all want to be essential
There's
because
probably something attached to that in the long run as far as compensation for their time,
Yeah.
which I think they probably should have, but we can't have every employee be essential. That's defeating the purpose.
Do you have a plan with some options on it we can look at?
well, I think someone read
Recommendations yesterday was for them to start coming up with some type of plan for some type of hybrid in each program, if they have to work at home, and some of them work at, might be essential and stay at the workplace. But I think, did you guys talk about that yesterday? I think there was a motion made by you to have them come up with some type of hybrid plan for the programs. You want to talk about that?
Yes, so because of the, a lot of the concern about people getting a free paycheck, or, whenever we do a shelter in place, business stops and people can't get services, the task force made recommendations that President Herman request all of his directors to create a hybrid working plan where people can do remote work and their offices can continue to function, especially with our numbers peaking, if we want to decide to go into like a hybrid working model. So that was one of our suggestions that we made yesterday. We think that, it's been working for a lot of other organizations. So hopefully that would work for the tribal organization, since we do have the largest workforce on the reservation. Thank you.
As far as the recommendation from me,
I really think that a shelter in place could work. But in the past, President Bordeaux took his recommendations from the task force. And so that's how he came up with his, shelter in places. And I guess I need a better explanation of why we wouldn't want to do a shelter in place, and the recommendation didn't come from the, task force, and why they didn't recommend a shelter in place.
I have a comment, Chairman.
Yeah.
Last year with the closure of programs, we had a large amount of old bills shuffled through budget and finance at the end of the fiscal year due to programs, admin assistants, program directors not coming in to handle those bills. So I think that we should look at those employees in the hierarchy of each program. But also I'd like to recommend a furlough, which I did last year on general funded positions. If we're not going to have employees working, then I think that they could apply for unemployment benefits.
Chairman,
Go ahead, Donna.
one other suggestion was, from the employees was to rotate the employees. So not only one is the essential, they all work as a team. They should be treated as one and rotate when they do their hybrid mode. Thank you.
it's a good possibility. Any more, Skyla?
So one discussion that was.
Great stuff.
One discussion that was brought up, but then this will be some future discussion as well, was regarding the pod plan for vaccinations. Things that we gave out, a lot of money towards vaccine payments, and we're still having, a lot of positive cases out there too as well. And, so what that pod plan was that,
So the pod plan was something that was developed prior to COVID. I mean, initially it was created after 9/11 for a mass vaccination of smallpox. It was in conjunction with the school district, PHN from IHS, and Top County Emergency Management. So the way we did it in the past was the pod plan was activated, and it was for mass flu vaccinations is kind of what it got used for. So we would take everybody, bus them to an area, wherever it might be. And the exercise we did it at Ben Rifle Auditorium in Mission, and we just took them and vaccinated from one end, did the paperwork, vaccinated, a waiting area, and then out the other door. And then we had mass vaccination of the flu. So that can be used for any vaccination or any mass event that needs to be done. It can be done, the plan's already written, it's in place. So it is something that can be done. The hindrance that we kind of brought up yesterday was, well, where would we do it? And with the flu vaccination, they weren't having to be monitored as long. Now you have to be monitored for 15 minutes following the COVID vaccination. So if we did say, if we had a good event that had 300 people, we would have to figure out a place to put 300 people staggered for 15 minutes at a time. And PHN and IHS already did something similar with the vaccinations. They had the vaccination sites around the different communities. For example, here in Rosebud, they did it at the men's fast pitch field, and they vaccinated, and then you just kind of went and parked. So it'd be kind of in that same scenario or that same realm to try to do something like that.
Okay, thank you, Eric.
Sure, Floyd.
Thank you. I guess before Skylar continues, I, wanted to back up and answer your question.
Okay,
The schools came in and they discussed how the spread that is happening amongst our youth is not being contracted at the schools. They talked about their plans being safe. They're really concerned about the high numbers of crime increases, and they were stating that they believe that the schools are a sanctuary for our kids, and that there's a lot of trauma and from kids not being in school, but most importantly, the schools or the students are very behind because of losing a whole year of school. And they don't think or foresee that they're able to catch up if we shelter in place. My suggestion was to shelter in place for only 2 weeks, so I guess I didn't see that that would hinder them, but it really did worry them. Todd County is at 80% vaccination for their staff, and St. Francis is at I don't see my notes for St. Francis here. Sorry about that, I don't have St. Francis's vaccination. 95% vaccination for their staff, and 100% of their athletes are vaccinated in St. Francis. They have cohort groups, and at TC Elementary, they have cohort groups and mask mandates, and that the kids have been really good at utilizing those. St. Francis is in a hybrid model right now, so not all their students are at school 100% of the time. So that was their thing for the schools. It sounds like they have pretty legitimate plans in place. The other portion, the biggest portion, I think that really played a part on the task force's decision is that a lot of our emergency response staff, especially LES, is out with COVID. And the chief said that he doesn't know if he has enough staff to really do the enforcement portion of the shelter in place, which plays a big factor in this. He said that he would be willing to do it if we had to, if we told him to, they would. He has a lot of stuff. So those are two of the biggest factors that.
we're okay.
Okay, you guys are good?
Yeah, we only have 2 off now. The other ones came in, retested, they're all negative, so they're back at work.
They're back at work?
I have a question, Councilman, to your point about resources. So in terms of additional funding, Chief Denoyer, do you need any more money if they were to mandate border patrol like they did last year with the ending of CARES? I don't think that we have the resources in the ARPA fund, but would that be something that you would be requesting, have that happened?
So the border patrol basically was done by the security, community security, that wasn't under us, that was under Bob Oliver's program. He oversees that, but yes, we would more funding to hire additional personnel.
So keep that in mind also, Council, with the lack of resources, the funding in the ARPA is depleting, and with the passing of the resolution for the youth facility, I think that just about cleaned it out.
Also, with the schools, Todd County did want to let us know and the public know they're gonna do a PSA on Thursday to discuss it more. If people aren't comfortable sending their kids to school, they don't have to. They can keep them home, but they have to inform the school, and the school will work with them. St. Francis has the ability to go online if that's what students want. So I think they're really trying to work with families. Another issue was a lot of overcrowding in homes. We were worried about that. That was a concern. And the main issue was our laws not having enough teeth to penalize people who are not abiding by the shelter in place, mask mandates, and whatnot. Anything, Stella?
Yeah, one other one I wanted to bring up was there were some, That those were the motions, remember the no alcohol ban and the curfew, so those were the two things that we thought would be, you know, to bring up again and reinforce, because they were enforced in the beginning
that was brought up by, specifically with Tuck County School District, was that if there was a reservation-wide lockdown, shelter in place, that they allow the IEP kids to still attend school because they were identified as the group of children that lost the most amount of, I guess, education time or response time to them. So I think if there was a lockdown, shelter in place, that group of students be allowed to still attend in-person school. Both, and I think, and I know Danny didn't say, or Neil from the SFIS didn't say the same thing, but I think she kind of agreed that was the same amount of kids that were identified as being, left behind, I guess, in the last year's school year. And I know the sports program at St. Francis, they had a pretty solid plan. I mean, I was pretty impressed with what they have going. We didn't really get to hear much from counties, from Chuck Wilson at the meeting, but I know that they have pretty similar guidelines in place. But we didn't see exactly what they're doing, if their student athlete population was 100% vaccinated or not. So those kind of things weren't really discussed yesterday, but I know they had a pretty similar plan. But the thing that both schools, I think, stressed was that they would be really against doing a shutdown, just because they're going to lose a lot of education time directly with the students. And the big thing that they stressed was just that a lot of times some of these kids, some of these students, that is their only one place to go. That is their only place to get, a hot meal, 5 days a week. So that was one of the big messages that they pushed out there, that sometimes getting these kids to school is their safe haven for that period of the day.
And then one other thing too, that the concern was their mental
health.
health, well-being.
Because they did see an increase in web searches for how to kill myself or how to commit suicide. So that was one thing that they had identified, that the mental health of the students were dramatically changed since then. Since being in in-person school to being out for a year and then coming back.
Any more questions for Skylar? Steve?
Good morning, Skylar, thank you, and all the task force and all your staff who have gone that extra mile to combat this virus. Like people have said before, they're on the front lines and they're dedicated, and they go out and they get the job done. So thank you for that. I'm looking at a couple of things here. There are things that we can still do, despite with the different school districts, the different entities out there, what their protocols are. One of them is testing. Testing, I think, is going to play a big factor, or can play a big factor on in moving forward. For example, we all know that there's always the way the virus spreads is it's got to have a carrier, and that carrier will go and infect another individual or individuals, and that's how it basically spreads. It's basic knowledge. And so there are some things that we're working with right now, and that's the schools remaining open. And I do think that it's very important that our children get their education, and also gets the opportunity or the time to spend with others and do things. But even in that setting, there are still things we can do. One suggestion would be testing, mass testing, continual testing. And meaning that when individuals go to school for that morning, that maybe they get tested prior to being allowed to enter that facility. Now, let's say we have a number of children not vaccinated within a certain school. And let's say we have a child go in there who is positive, but nobody knows that. And what are the chances, we have to ask ourselves, what are the chances of that child affecting the other children? And then them children going home and affecting others. So if we had this mass testing available and we had it in place, we can avoid some of those situations. And that's just one example. Another example is with our tribal employees. Let's say, for example, we tested them prior to going in their facility. And chances are that we might be able to catch the ones who are positive and then send them home, instead of everybody, even the ones who are negative, testing negative. And so if we had this mass testing in place, I think that's going to be key to combating this virus right now. This mass testing in place where if we can do these things, we don't have to put all our members and non-members in one category and send a whole bunch home. We can continue to function, keep our schools open if we had this mass testing in place. Now, I've been giving it some thought, and I think that's probably should be one of our main goals right now, since we're going to still go with the schools opening, children being allowed to go back to school, and I think that's a good thing. Mentally, emotionally, and it's good for their education. I think it's something they need. I have a lot of grandchildren, and I've seen it too, how it affects them. But there's got to be a solution. And if there's a solution there, or a possibility of that solution, we have to do it. And I think that's one of the solutions, one of the ways we can combat this. That's the only way I see that we're going to prevent more spread of this virus. The other thing is this, it's been a long 2 years for the entire world, actually. And people are getting COVID fatigue. There's a lot of depression out there. And some people are just saying, well, I'm just tired. But I don't think that's the way to go. This is not the time to give up, especially with those numbers that we have now. We've got to remember also that there's a large portion of our society who cannot get vaccinated. We have to look out for them, the young ones, 4 and under. We have to do everything that we possibly can to protect them also, because they don't have that option of being vaccinated or not. I wish we did have that option to vaccinate them, to protect them, but we don't. So it trickles out, and it just moves from place to place. And I guess what bothers me is when these little ones start getting it. Or if there's a different mutation of the variant, and it's more deadly than what we've gotten so far. That is scary. And we have these little ones who can't vaccinate it right now. The babies who can't even speak for themselves. It's up to our parents, grandparents, and society as a whole to stand up for them, protect them. So I see that as one option. I think it's a very good option. the mass testing, having it available. Do everything we can. Put all our resources together. Let's get these tests. But let's also work with other entities who are going to allow a lot of people in one building or meetings to be tested prior to going in. And if we can catch the positives from mingling with ones who are testing negative, then I think that's going to be a start. The other thing is let's not go backwards. Let's not give up. I see a lot of that out there. You know, from the COVID fatigue, people are just tired of it. But let's, like I said before, let's double our efforts now. When the going gets tough, let's let the tough get going. Let's do it. Let's not give up. Let's not take 2 steps back. Let's move forward. Take a deep breath, get our second wind, move forward and continue to fight this virus, to protect our people. And if we just give up and do nothing, chances are it'll get worse, as we all know. Chances are we'll lose more lives, you know, and we don't want that. So let's continue to, let's pull together. Let's not blame anyone, any entity. We're all in this together. Let's all stand up together. Let's all put our heads together. Let's all make the best decision that we can to combat this. Vaccinations, let's continue to push that. Our numbers here on this reservation are very low. Let's continue to push that. I received my free vaccination. If there's a 4th one going to come up, I'm going to take that one too. And to date, I'm very lucky that I haven't contracted it yet. I think one of the main reasons I haven't contracted it yet is probably this mask that that's protected me a lot. I think that's one of the big factors. So, thank you for listening to me, and let's fight. Let's get our second win. Let's do this. Let's not give up now. And our people need to join this fight. All of us. We need to be in this together. Protect one another. And like I said, there's the little ones that can't get vaccinated right now. Let's do everything to protect them also. Thank you.
Council, I'd like to hear from IHS. Kelly, do you have any information on the vaccination rate and why people are not getting vaccinated like they should, or is there enough information out there to encourage people to come vaccinate? I know Eric talked a little bit about the mobile type clinic that's so we can go out and vaccinate, but do you have any information on the vaccination?
I guess, in talking with the vaccines, yesterday,
I haven't really received any feedback of why people are not receiving the vaccine. We discussed yesterday that I could look at our data. We offer a vaccine clinic in the OB unit at the hospital Monday through Friday right now. I can look at that data and see what day I could take away from there, and we could go out into the communities again and offer that vaccination to each community and see if that would help. I don't know if it's people just don't want to come to the hospital to receive their vaccine. Convenience, I'm not sure. So we're willing to try some different routes to see if that would increase vaccination rates. But I have not received any solid feedback of why people are not getting vaccinated.
Okay, we have Pam and then Lisa. Pam?
Morning, Council Administration. What is IHS's thoughts on all of this that's going on? As far as what is a plan from you guys to the tribe in helping us combat this? I mean, because right now, everybody is after the task force. The sole thing seems to be that the task force is the one that created all this problem. But in the long run, I look at it as IHS should have been the one that should have been doing all of this. So what are you guys doing as far as helping with correcting all of this?
We continue to work with the task force, support at IHS, we continue to follow the CDC guidelines. With the task force, it was recommended that there's the 10-day isolation. So even at our drive-through, people come through, they're positive, we're supporting that and telling them that they should isolate for 10 days, that the task force is recommending a 10-day isolation period. So we're working together with people. We continue to push the mask mandate at the facility. We're offering education. It was discussed yesterday to get together and do some more like Q&As or PSAs to put education out there to support this. In order to, it's really hard to, people want to, make them want to get vaccinated. We've tried different techniques, methods going about approaching, but that's what we're doing right now is we continue to stress when people come to the hospital, we offer education. We're doing the drive-through testing now. We're offering education there also. And PHN, we will work on, they're doing vaccination clinics in the community, like at the schools and stuff right now, offering the boosters and stuff. So open to suggestions of what think we could do better, and we're willing to work with people to make that. I mean, we want this to be resolved also.
Well, one of the problem areas that I see happening a lot is the ER department. A lot of people have the symptoms of COVID, but they're the same symptoms as influenza, common cold, flu, whatever. They have the same symptoms. But I've noticed that when you enter ER, you sign in, you sit. But then here's somebody sitting there coughing around, whatever. But there's nobody going through and like actually sanitizing that waiting area. Or there's no kind of education given as far as you may have the signs of COVID, but it could also be influenza. So instead of coming all the way into ER and signing in and, creating the possibility of you catching COVID, is there any way that we can stop them at the door? And, I guess a lot of people don't understand that the ER is basically for true emergency, life or death situations. They don't understand that. I think that's part of the education that you guys need to give out there. Rather, they should be utilizing the daily clinics for that. And also the daily clinics, if you have a day that is filled with appointments, where's the walk-in process in all of this? The walk-in person ends up having to sit and wait to see if somebody cancels their appointment. And those are just basic things that are happening up there that a lot of people are getting frustrated with. Now, you came to our meeting 2 meetings ago. I think I can't remember which one it was, but we were told that there was only 5 ventilators up there. Where are we at right now as of today? How many ventilators are being able to be used?
We still have 5, so we have 2 in the ED, we have 1 on inpatient, and then we have the extras if we need them. But recently, with looking at people that present with COVID, we have not had to intubate anybody recently. It seems like people are not as sick as they were previously before, like everybody was getting vaccinated. So we continue to have the high flow oxygen, which we haven't been using as much, but we have been. It's available if we need it, but a lot of our people maintain on regular oxygen or
just room air. So we have plenty of ventilators. If we need to get more, we could work with our area to get them, but we haven't needed to use those.
Okay, and then also, my last question, I guess, it goes back to the vaccination numbers. You guys give as of the 14th, you guys gave a total number of 46.4%. Okay, what I want to know is where does that formulation come from, as in, if only 8,906 have come in for a vaccination, how did you guys come up with that 46? I mean, are you basing it on who all is enrolled at IHS under the chart numbers? Is that how you guys are coming up with this 46?
The denominator is calculated on the user population for IHS. So that is calculated if a person's had any type of service, one service within 3 years, then they go into that denominator.
Okay, the reason why I bring that up is because we look at our ARPA funds for direct payment for on reservation. And for on reservation, we have 9,155. And according to IHS, you guys have 8,906 vaccinated. So to me, we sit over 50%. That's how I see it, but I don't know, maybe that's something that someone else can recalculate. But if you're going over the overall IHS numbers, then that becomes a different question of how can you accurately give us the numbers that are here at our IHS. So I think that's something that needs to be looked at and refigured, recalculated, not based off of everyone using IHS. Thank you.
Lisa?
Thank you for coming down. I think a lot of that number too, Pam, is like out Easter, as I know we have some child members that may utilize dental, but then they don't get their regular doctor and they'll go to Vera, so. Yeah. So they're considered on-res and they got that part out. But, on the vaccination ages, is there, like, do you guys go by age groups to see, like, is it the younger generation that's not getting vaccinated, or like the middle-aged, or is it mostly the younger generation, like the 18 to 25 or something? If you group it that way, I don't know.
Yeah, I haven't seen any grouping like that. I just reached out to Quality to see what our vaccination is for those age ranges. As of right now, I just have the 46.2%. I'd be glad to provide that data, and if she doesn't have it, we could, I'm sure, calculate
Because it seems like I know, a lot of young adults that refuse to get it, and then maybe that's where this is coming from, and, there's different, thoughts they have that it affects fertility and stuff, so, and I don't know, maybe we could target that group to try to get them vaccinated, that's the case.
Any more questions for Kelly? Thank you. Skylar? Any more?
No, I think fine.
Okay, let's talk a little bit about if there's not a shelter in place, how are we looking for the numbers? How's our task force gonna keep up with all the requests that they need to do as far as providing them with, food, cleaning supplies? Is it even possible, or what do we have to do to make those, your employees a larger number? Are you advertising for more taskers, or what are you doing to keep up with the numbers, Skylar?
So, what I do is I just have people, when I apply, when they come, because they're temporary positions.
Talk to the council, please.
So when they're temporary positions, we don't have to advertise that, and with these, tracers is that they're long-term temporary, positions. Hand the application into the HR department, and then we just check daily to see if there's applications on file, and, if we need more help, we just put them on immediately. And, So if we do the shelter in place, we all know that it requires more positions, more hiring, and so we would just go with, you know, who we have on hand as far as applications and just get them on board. But that hasn't been determined yet, so.
Itancho?
Chairman,
Yeah, go ahead.
Thank you. Good morning, everybody. Thank you for coming down, Skyla. I have a question about the quarantine portion. So do you guys have anything in place as far as procedures with regards to having different people in the quarantine trailers or anything like that? Just because you know, we have questions of about the different strains. So if someone goes in there and they go in on a certain day, right? And let's say they're not vaccinated. So it's what, 10 days? And then someone else comes in maybe 5 days later. How do you know it's not a different strain? How do you determine if they're going to reinfect each other? How do you figure things like that out?
So I have Catherine that will explain that process, because she deals with the isolation and the quarantine, individuals that go into those trailers, so I'll have her explain how she just determines that.
Okay, so, right now, if it's a different strain, you wouldn't know who it is. But the same treatment, it's the same, no matter what, no matter if it's Delta, Omicron, or even the Alpha and all the other ones. It's still the same treatment, it's still the 5 day, the 10 days that we're doing. It's still the monitoring and everything. Nothing changes on it, no matter what their variant is. When someone goes into our trailers, there are going to be multiple people in there, and we ask everybody to wear a mask, no matter what. They're all positives. They can't really catch it from each other, but just as a precaution, we ask everybody to wear a mask, no matter what. So pretty much, it doesn't really matter the variant. It's all the same treatment, so we just kind of treat it all the same. Until we're told otherwise, that's how we've been doing it, and that's how we're going to keep doing it.
Steve, did you have a question or comment?
Donna too.
Go ahead, let Donna go. Go ahead, Donna.
My question is, food cards, you have people in the quarantine trailers. Are they fed separate, or are they allowed the food cards, or how are they getting fed?
No, we won't give a food card to somebody that's in the shelter, only because 3 meals are provided every day for them. If your family can drop off snacks and stuff like that. We don't provide junk food for these people. We will provide like food, like extra stuff, like if it's needed, or soups or something like that. But we don't give them a food card because we provide the meals and help them with whatever they need in there.
Thank you.
Chairman, I have a question. So, Skyla, with your tracers being limited, in terms of the amount of tracers that you have with their pay, are they paid time and a half for hours worked outside of 80 hours?
So like, excuse me, sorry.
Outside of 80-hour work periods, are they paid time and a half or anything other than their hourly rate for those additional hours worked?
It's just, they just get paid for, like, if they have 100 hours, that's what they get paid for at their regular rate, so it's just straight up.
I would like to advocate, because there is a limited amount. I did see a mass resignation of tracers, and I know that there's been a transition in leadership, but I'd like to advocate for a pay increase for them, maybe temporarily until they're fully staffed, Chairman. But I would like to advocate for that. I think your budget can handle an increase for the tracers to receive. Thank you.
Also, to give her more funding to get more tracers.
Donna, we talked about that, Skylar, and I talked about that, and I asked her to submit a budget so we can make that happen as far as hiring more staff and more food cards, because she's running low on food cards. So since you guys gave me the authority to do that,
I will do that as soon as she gets me the budget, okay?
Thank you.
Steve? Hi. My question is, where are we at with testing? Do we have any intentions of, getting these home tests, these kits, and distributing them, maybe set up various different, testing areas, throughout the area? I mean, just push testing and that way it'll help you and your tracers, all your staff, it'll help us to know where the bigger outbreaks are, how it's actually happening. We can get a better picture of that. And I know you've been doing this for a while, you probably have a good idea of it already, but I'm still concentrating on testing. That's why I need to know where are we at with testing. Are we gonna order these kits that are coming out? Do we have any intentions or?
Yeah, so what's happening is you can go online on this site or this link and order, home tests for your own household, and it's, free. And then also I'm working with the area office to order, test kits from the federal supply. And, so I have the application filled out, and then I just need to do one more step to it and then have it sent out. So we can get these kits, that are possibly be free to families, that they can just test them their own homes.
Yeah, I think that's a good idea. The sooner the better.
Yep.
Are numbers still increasing weekly, daily? Are they still on that trend? Because the numbers I saw lately were pretty high. And those are the numbers, I mean, the ones who actually got tested. I imagine there's people out there who are positive, who haven't gotten tested, and who don't have any intentions of getting tested. So I think the numbers would probably go a little higher than that, but that's why I think testing, and then also maybe putting in, considering some requirements for people going into, let's say, a public building, that they be tested prior to allowing them to go in. I think something like that would help us get some of them who aren't getting tested. A number of different things, but I'm just bringing this up because I think it's an important part of the testing right now because of the numbers going up.
Yeah.
And we don't really know if they're going to continue or not, but then that's one way to catch them. They started someplace. And I think, as you and your team already knows, is that a lot of times you're just lucky to catch a positive, that they probably didn't even know that they were positive. That's why people go in to get tested, because they don't know for sure, but they want to find out. I think testing, and if we can get access to mass testing, I think that would help a lot.
Lisa, then sure.
This morning on the news, I seen where they had the government sending 4 free tests to your residents. So if you go to covidtest.gov, I went there this morning and you put in your address and they send you 4 to your residents for free. So put that out there. Those will go to individual homes.
Sure.
Thank you. Some information was shared regarding testing and some recommendations were made, when Deanne was, contracting with Skyla. Regarding the testing, the tracers, it was made a recommendation that the tracers no longer offer testing temporarily while the numbers are so high, because they're tracking so many people. I just took over the testing. They're doing drive-through testing and their hours are pretty long. Monday, it was reported to us that they did 168.
Yes, about, Monday we did about 164 with 52 positives. And yesterday, close to 200, and we had 61 positives.
And so,
that includes like people testing multiple times. So somebody might be positive and they're coming every day just to see if they're going to test negative.
So there's issues that came along with testing as well. And I know that it's going to be on the task force to get that information out to the public, because some people are testing too soon. And coming in, testing every day because they had a contact, or having, testing too soon and thinking that they're COVID-free, so then they're going out into the public and spreading the virus. There's people all piled in one vehicle, going through and getting tested, one person in that vehicle being positive and the rest of them being negative, so that person infected the whole vehicle. So there's a lot of issues with testing that need to get worked out. Yesterday, we talked about, the vehicle that Skyla has, they're temporarily, broke down right now, right, Skyla?
Yeah.
To get out into the communities, where we plan to meet on Monday, at our meeting on Monday, to discuss more about how we can get out into the communities for possible vaccinations and possible testing. So we go to the community, but I just wanted you all to be aware of that because I think testing is important. However, it does pose problems too when we host testing, mass testing.
Any more for Skyla? Russell?
I'm gonna take my double mask off.
Oh.
That's the guy you can feel what kind of picture. You know, we've been at this for over 2 years. And we formed a task force back then to, when you form a task force, that's to kind of give us direction and advice to what we're supposed to be doing. You know, we got a big chunk of money from the CARES to establish all this. And yet today we're faced with another crisis, which is a spike in our people testing positive. And here we are again talking on what we should be doing. And I don't think we learned from the past 2 years anything. I think like we're operating on a crisis mode all the time. And it seemed like bottom line is it comes down back to money or personnel wanting more money or needing more money. It seems like we don't learn our lesson. And this kind of bothers me because, you know, we should have a plan in place. You know, we have asking for cleaning supplies, even though they don't. There's no COVID in the family. Those are things that we should be looking out for. You know, instead of masks or, you know, we should be able to help our people when they need help in terms of cleaning supplies, cleaning equipment. You know, right now, we're getting more and more requests of food. People running out of food, especially elders. And people need a place to call and actually get somebody on the phone. You know, I experienced that yesterday. People call me and tell me we can't even contact this office or your offices. So out of curiosity, I tried calling. And we can't even get through to people. I think our people need to be able to talk to someone. You know, when we're in a pandemic situation, people would like to talk to people or get some kind of answers from individuals. Even though, you know, maybe on the other end they're upset or maybe we are in a crisis mode. And you have to expect that. But we never really trained our people to be person employees either. So when somebody calls you and they're upset, our reaction is to be upset too. that creates, animosity. But one of the things that we need to really concentrate on, and bottom line, it boils back down to money. And we have the resources right now, and all these entities, Indian Health Service, task force, the members, we have all these resources available. Yet here we are, we're talking about, we're rehashing a lot of things that should have been in place, could have been in place. And it's not gonna, this virus is not gonna go away next week or the following week. It may take another 2 years, maybe 5 years. We don't know that. But learning from experience, we should at least have a comprehensive plan in place so that we're not sitting here rehashing, every month. There are needs out there that we have to address in conjunction with this virus. If we're gonna, we tried several times trying to get people to stay in one place. I mean, I'm a good example of that in Black Pipe when they initiated stay at home. Yeah, they kept people from leaving the community, but people passing through the community was wide open. They even threw them different routes where they can go around the community. I mean, it didn't work. But we are in a crisis mode, I would think, with the high rate of infection. And we're really lucky, fortunate that people are staying home and recovering. That's the important thing. But when they're staying home and recovering, we need to respond to them in a timely manner. I've been getting calls of people, no one responding to them, individuals. I think we should have and still can have a good policy in place. One of the things is education. Somebody just brought that up here again. When we first started this, there was a lot of dialogue going on. There were daily radio announcements between Indian Health Service and our tribe, just getting that message out to people. But we've become lax in our attempts to do that. And anymore, because of the complications of this virus, we spend, we go off the walls talking about everything else and not going to the specific issue at hand. So we need to get our act together here, I guess. And again, I'm only one person sitting here, maybe thinking this way, but it is my thought. But bottom line, when it comes down to it, then it becomes a money issue. And right now, that's what we should be talking about. If that's the issue, then let's deal with it. And like I said, it's not going to go away tomorrow or the next day or next month or maybe even next year. We have to look at long term. When this ARPA funds came into play, I think we had 4 or 5 years to spend this money. Yet we're acting like we have to spend it this year. And we have been. I would think we need to take a step back and reevaluate ourselves and how we have the system set up. We've had 2 years of practice, so we shouldn't even be discussing it here. We should have a plan in place and implementing it. Yet it just, it's mind boggling. And I bet you anything, 2 years from now, we're gonna be sitting here flat broke and be talking about the same thing again. And not even have a plan. You know, we have people out there who have needs. You know, it's cold again today. You know, there are people sitting out there with no heat. There are people standing out here and asking for food. We don't have a plan, and you say you guys gave out cards. We're low on cards already. You're asking for a budget. I don't know how long ago you asked for this plan or budget, or, you know, how long is it gonna take? There's many issues here today, and I would like to see us leaving here with a good plan in place, educational material out there to our people. If it's a budget issue, let's discuss it. Otherwise, you know, we're spinning our wheels. Well, that's my 2 cents worth here today. How are we gonna address these? You know, people need to answer their phones. People need to respond to the needs of our people when they call in. Somebody mentioned vehicles. They can't even go out there because they broke down. How many vehicles do you have?
Donut.
I mean, we purchased a lot of vehicles for the CARES Act. And now they're all broke down, or some of them, I don't know. We have that as an excuse. People can't come in either. People living out in these outlying communities, they have a hard time coming in. They can't come in on a daily basis to get tested. Maybe they want to, but they can't afford to. There's a lot of things we need to talk about, serious stuff, I would think. But, you know, at the end of the day, it's gonna boil down to, well, we need more money. Tracers, we need more personnel. Maybe we do need personnel to actually sit in front of a phone and answer phone calls for people so people can have an answer. There's things we can do. We have 2 radio stations. There should be some PSAs all the time explaining, in layman's term, mind you, so people can understand. We have a TV station, I guess. You know, we have to get serious. You know, if we need to do a lockdown, let's do a lockdown and do a major lockdown instead of a stay-at-home policy. The stay-at-home policy doesn't work. I mean, it's business as usual. Thank you for listening to me. I know Sergeant at Arms is looking at me with this 3-minute look in his eye. So I'll stop right now.
That's Steve Noyer and Sheriff. Good morning and happy New Year to all of you that I didn't get a wish happy New Year to. Last week, there was a motion made here to get on the same page. And I feel like we're still discussing the same stuff that we discussed when this pandemic first started. A lot of the stuff that was mentioned here today is in place. Yesterday at the task force meeting, I asked for all of the laws that were put into place during the chairman's declaration at that time. What was taken out by council, what was stopped. Take a look at the laws that were enacted during that time and which ones were taken out by resolution. those are things that I need to see today so I can develop a plan on what we do. We're kind of waiting on you guys to make a decision on what we want to do. We'll do whatever you guys ask us to. If you want to shut down, we'll plan for that. If not, we just need to know, so we can start putting our pieces together. Funding shouldn't be an issue here. We got a lot of money for who had COVID and the pandemic that is in place right now. If you guys are planning for other things, that's, again, your decision. I don't know where we're at with any of the ARPA funds. Surely there's some programs here within our tribe that needs sufficient help with those funds, but I haven't received one word from anybody, and I've asked probably over half of the council people where we're at with that when you're taking proposals, and I don't get a straight answer. So I don't know where we're at with any of that. It seems to be a big secret. Lay it out on the table. I mean, we're dealing with a pandemic today, and to hear, no offense to anybody that's spoken here today, but we can't continue to wait for meetings next week or next month or anything. If you feel there needs to be something done, do it. That's the authority that you guys have as a legislative body. Today, we have 20 communities. Pick one. Start with Rosebud. Go to St. Francis. Go to Antelope. Those are the high volume areas where we have the most positive right now. Send these tracers to Antelope. Start testing. Send them to St. Francis. Start testing. Bring them here. Just start the process. There's no reason to wait around. That's what today's meeting is supposed to be. But as Russell puts it, it seems like we just spin our wheels. And, I said some things yesterday and at the meeting up there at the Water Resources Building. It seems like we just discussed the same over and over and over. And I personally think that we should have office separate dealing with this. It takes out a lot of the political drama. Somebody can just specifically on that. I'm not saying that these guys ain't doing a good job, but to have them constantly be coming down here and reiterating everything, and they're short-staffed. I see that. They need more help being out in the communities. That should really be a priority to get that help in the communities, especially the outlying communities who don't have that transportation to get in here. Do I think a shelter in place would work? I think our people don't listen. And I think that we're dealing with a different virus right now, and that's why it's so high, it's so contagious. We can do a shutdown for 2 weeks, a month, whatever. But once that lockdown stops, everybody runs to out of state, wherever. And all it's going to take is 1 or 2 people to get that virus there and bring it back here, and it starts back over again. I know Eric said he was getting alarmed at 80 when we were at 80. I came down and talked to the chairman when we were at 20. I was alarmed when we hit 20. That was way back in October, November when we were at those numbers. I thought we should have been doing something then. But he didn't have the authority to do anything. Now he does. But we really need to determine which direction we're going to go. If we're going to have a shutdown or not. Let's make that decision so the rest of us can start planning on what we need to do, because it's got to happen quick. if we're gonna do something, it probably will bring the numbers down a little bit. But, you know, once people start getting out and about again, you know, Eric brought up a good point yesterday, when we had the shutdown before. We opened from, I think, 6 AM to 6 PM. I believe those were the times. And everybody congregated at one or two stores. The stores were willing to work with us, but we never did ask them to develop a plan on allowing so many people in at a time. So if we do a shelter in place, those store owners have to, coordinate with the tribe and, you know, only allow so many people in their store at a time if we're gonna get, you know, I can't even believe that we're talking about still wiping things down. I think Pam brought that up at ER. Most places are really good about cleaning their stores all day long. The casino is really good at keeping their machines. You guys have a tough decision. But law enforcement will handle whatever you guys decide. If you decide to do a shutdown, we can do it. In fact, 3 officers come back today, tested negative. They're back at work today, so we only have one out. He'll be back by Sunday, and we'll be at full capacity. So, you know, we're just gonna have to work through with whatever you guys decide, but we can handle it. Whatever you decide, so, thank you.
Hey, Cheryl. Thank you. You know, I wanna address this council because things that are being said here, I have been talking about this task force for 3 weeks now when our numbers have started to rise. I have been barking up, you know, the tree here and nobody's listening. Now we're at 200 and something and now we want to have a meeting. And now we want to make it important. And I'm sorry, but I am very upset today because there's a lot of work that needs to go into this and suggestions were made by me and by some of my colleagues that we put a specific person in place over the COVID task force, have that person be a COVID task force administrator. That fell on deaf ears. Nobody listened. And had they listened, how far would we be? Would this plan that everybody's talking about be in place? It probably would. We took a vote on it here and you all voted it down. So you said, let it play out. Here we are today. So I'm standing here frustrated because a lot of the complaints, a lot of the things that people are saying, a tracer's job is for contact tracing. They are supposed to contact all the people who have close contacts or have COVID. They're not supposed to be doing testing. And they can't do testing. With 250 some cases, how many other contacts are those that they have to make? They had 9 people out because they caught COVID. Now, we do need to get a handle on this. We do, and we do need to create and establish a specific office that handles these specific public relations and education, occupancy and trailer maintenance, inventory and distribution, the tracers, vaccination, testing, and policy suggestion. Those are the areas of focus, and they're all being handled as they come because we are in crisis mode. This body has lived in crisis mode, not just us, but all prior administrations. I've watched it all my life. So today, let's get out of crisis mode and let's take some action because I'm tired of sitting here listening to complaints and no solution. I think we really need to just have some solutions today. So I want to make a motion to have a shelter in place and you guys can vote it up or down for 2 weeks. And that's my motion.
I'll second that.
Mr. President, it's Concha. May I have a word, please?
Who's seconding that motion?
Michael.
Micah?
I'm next in line for the floor.
Steve was next, and then Skylar.
Okay, can you,
Motion on the floor, we have a second.
can you repeat,
I'd also like the floor too, Itkancha. This is Dara Ayat.
the motion and we'll continue with the discussion? You didn't get it? Sarah, can you repeat the motion for the secretary, please?
Motion to have a shelter in place for 2 weeks.
Reservation-wide shelter.
Yeah, reservation-wide shelter in place.
Second by Micah.
Stephen,
I do just want to say one thing about the ARPA committee. It is no secret the discussions that we have. I send the budget and the reports that we are given to the council reps that specifically request it and directors that specifically request it from my office. We do have meetings that Jim schedules, the ARPA office does schedule, and anybody sitting at this table to attend those. They are no secret. We are not hiding anything. The vaccine incentives and the direct payments took over half of the ARPA fund, and the youth center of 13 million pushed us closer to having no money left in the ARPA fund. So if anybody wants that report, I did send it to all directors and to council. If anybody else would that report, please let me know. Anybody would like meeting minutes from the ARPA committee, we do have a secretary in there who takes those meetings, and we do have an elected secretary who has all of that information for everybody. So again, it is no secret. Our meetings are no secret, and the discussions that we have are no secret. I do, Chairman, want to ask that we have no more unofficial meetings that conflict with scheduled meetings that are identified by ordinance. With the last two ARPA meetings that we had 2 unofficial meetings put together by council, which were unofficial, but I think some of the confusion could be alleviated if we all were in attendance of meetings that are actual meetings. Thank you.
Okay, I need some clarification on your motion, Chair. Are you gonna include schools? To include schools?
Yes.
And that would be with the curfew and the businesses, or the businesses gonna be in the same, or is that up to me, for me to decide?
Yep,
Okay. Okay. Lisa?
I think you can set those guidelines that we should follow. You know, you have your essential employee list.
I have them, had them all turn them in, so, like I said before, a lot of them, did just a bare minimum, staff, and a lot of them wanted their whole staff to be working, so.
Then are we gonna enforce the law that we have in place for finding for curfew and if they're not in quarantine?
Curfew is already from 12 to 6 p.m. in the morning, so we'll just enforce that. I think there was a clarification I needed to make with the people over here on what that.
And how they were gonna enforce it, so they said they would enforce
Then are
it.
you gonna cancel meetings and committees too?
Yes.
Are we still going by the,
The last shelter in place,
in a
the
gathering?
only meetings you guys did have was council meetings.
Are we still gonna follow the no more than 10 in the gathering?
Right, so the amount of people that are gonna be in the meeting are gonna be 10 like we did last time.
Dara had a question.
I don't know, Dara and then Russell.
Okay, hello, administration, Itkancha, Willie Kendall. Good afternoon. It's almost lunch. I know you guys are probably all ribs. And I just want to, I have a question for you, Skyla. As of December 31st, there was the CDC withdrew the request for the U.S. Food and Drug Administration's real-time RT-PCR diagnostic test because there was too many false negatives. So what testing do you guys use?
The ones we use are the PCR and.
The current tests we're using at the drive-thru are called the Buy Next Now test. They're an antigen test.
Yeah.
At the hospital, they use the Abbott, which is also an antigen. And then the PCR is the swab that's collected and can be sent out to the state to be sequenced, which indicates variants. if they do
Okay,
come
well,
back.
that's what I'm worried about because that's what got withdrew by the CDC from the Food and Drug Administration because there's so many false negatives, so they're not working apparently. So what are we going to do about that? You know, there's many questions that we're asking. Russell hit it on the nail when he said that 2 years later, we're just spinning our wheels, and we are. These are the same exact questions that us Oyate watched the last administration go through. The bottom line is that about $200 million went through. Now we got broke down vehicles sitting outside of buildings. We're as red as it gets. Where are we going with this? I'm in favor of this shelter in place for the whole res. I seen what it did the last time. I was an employee at our higher learning institution, and it seemed to have worked. There's a lot of cases where I was almost at 300. Nobody's worried about that. Nobody's worried that 282 people that the IHS tested, and that's not Horizon, that's not Winter, that's not Cherry County. That's just IHS, and it's not very good. We all know that. Now, as far as anything else, the food cards, just whatever's been given from the task force, you guys are doing a hell of a job, but there's only very few of you. And I have a relative that asked me yesterday, he got positive on the 8th, and it was the 18th, and he still never received a call from you guys, a temperature check, a box of food, and he was getting hungry. So I had to make a call to Bob Oliver to get some help for him. That's really shameful. He's from, he deserves that compassion. And so, there's a lot of questions. We're at the same stage. The only thing now is that we blew through a bunch of money and we still need more. I don't know what it's going to take. I thank you, Sherry, for that graph earlier. That's important information that our Oyate needs to see and get explained to them. And that's not what's happening. We need PSAs. We do have those 2 radio stations. Why aren't we hearing Itlancha Herman's voice all day long telling us these things? Apparently we're a nation that has to learn from example, from bad habits. We learn from mistakes, but we don't have to keep going like that. We can learn from them instead of repeating the habit. I'm for a shelter in place. I know that the kids are affected with the school as far as the education and stuff. But once again, we have to look at our home lives and we have to remember that we're their first teacher. So we should be able to have that relationship with the schools. Right now, St. Francis, Wopilatkanka to the Owaiowa there, because my child's sitting in the living room going to school right now. And that's where he's safest. As parents, we have to make them decisions for our children. And I just think that, we really need to look at this situation from all angles. I've been talking to elders. A lot of them are getting hit. They're in favor of the shelter in place. One thing they are scared of are the homes that, there's a lot of excessive drinking. Here in White River, we have a couple alcohol places. I remember during the lockdown, we got a lot of the after 5 crowd from the tribal employees here at the Gus stop. It'd be super packed with people buying booze. And I have no problems with people in their social lives, but the drinking, maybe we can ask ourselves, do we want to live? Can we stop drinking for at least 2 weeks so that we can get a hold of this? Because I see the bar up there on Tuesday and Friday nights. It's packed with dart players. Nothing against the way you take out your frustrations by throwing a few darts, throwing back a few beers. But you're also affecting a lot of people when you walk out of that place and go back to your homes. Maybe grandma's watching baby. There's a lot of things we have to take. I went by Allstop yesterday. It was packed to the gills. These businesses, they needed to be told by our task force and our administration from the past about attendance in there. These are things that we're just talking about that should have been done a couple years ago. I think that we need to shelter down, and I just really think that we all need to get together to think a little more collectively. Thank you.
Russell.
Yeah, somebody mentioned a group of 10. Now, how do we handle funeral? Wait,
I think
I
that
knew
was,
there was a policy in place right from the get-go. We never really, we enforced it in the beginning, but then it just kinda died out. But, you know, there are many deaths too. And I experienced that. And so how do we handle that? Within the next 2 weeks with this motion.
I think we have the protocol that we did last time is that there was just no wake. They basically went from the home to the grave site.
I had to bury my brother like that.
Yep.
And, you know, it's not a very good feeling.
No.
And, you know, it still haunts me. Just about imagine what families are gonna go through when we, as tribal government, say no to them. So I think we need to develop a separate policy. I would think, and I'm still gonna continue helping people who are grieving and needing my help. So, I don't think we should put, you know, we should have a separate policy for that.
Chairman, I do have the policies that were created in my office. If you'd like a copy of those, I sure would. Hold on to those. I think you should get those.
Anybody else? Oh, Skylar, go ahead.
So listening to everything this morning in the short duration of 2 hours and 5 minutes before lunch, and we are forced to deal with the huge task, and Russell is right. We've been doing this for going on 2 years. March 15th will mark our 2nd year anniversary, and we should have learned a lot from our first year, and we've tried to take a lot of this information as constructive and make something better and do something differently. If that one didn't work, let's try something else. And money is always the issue. That, Russell's right about that too. Everybody's right about that. Money is the issue, and it requires more staffing, and so, we've always forced to make do with what we have and use that to our advantage. And then there's a lot of finger pointing and a lot of the stuff, and then these are just my opinions. Everybody got to express their opinions, so I should be given that respect to voice my opinion, and I may not speak for all my colleagues in the task force. We're pretty close, and that relationship has brought us a very close working relation amongst my colleagues on the task force. And when you're on a task force, you stand united and you stand together. You don't have an opposing party in all of it, because it won't work when you're gonna have that one broken piece when you're not standing united together. And we may not all agree on something, but we stand together. And I really think that it's a slap in the face when we're constantly being threatened. Take the task force from them, put it somewhere else. Bottom line is we just need more money so we can hire more personnel and we can fix these small issues. And another thing is that we do have policies. We have a process, we have a protocol. And I've spoken this with Micah one-to-one, and I've had this conversation with her, and I let her know, and I've let several other council people know, one-to-one conversation. We have protocols, we have processes in place, but we are always forced to deviate from that protocol, that process, so it makes it look like we're all over the place. We're doing something over here, we're doing something over there, and we're forced to do it, to go in those directions, because the amount of calls and the people know we've been dealing with this for two years. We know the process. If you're positive, you're gonna get a referral form. The tracers do the form, and they're told that by the tracers. Am I right, Catherine? That they will get a form, and that referral form will go to CHR. They have 24 hours to do your food delivery. and you're cleaning supplies. But the minute they're positive, you want everything. But these are ARPA funds, and it's all about accountability. And we're good at throwing people under the bus when it comes to someone getting questioned or whatever. Nobody's gonna back the task force when the auditors come in here and say, Pam got a food card. Let's look at her file, but she's not even positive. So that's an unallowable cost. You guys need to realize there's a lot of protocols here, and I'm sure the treasurer can agree with me on that too. And so when going gets tough, sure, but the task force is the one that's gonna get thrown under the bus when all this thing gets questioned and all this blows over. So that's why there's all this paper trail in place, and I grew up here, I was born and raised here. I'm all about the Oyate too, because I come from this tribe. But when it comes to support here, we need a lot of backing, and to be changing hands and removing the task force and putting it somewhere else in the middle of the pandemic is not the answer. All you're gonna do is create more turmoil. Sure, that may sound good, but I'm sure Steve, other colleagues here that been dealing with crisis modes can agree with that. That's not the answer. And then the other thing is, I don't know, you know, a lot of stuff is based on innuendos and hearsay. All our vehicles are up and running. I just bought new tires for all 8 of my vehicles. So I don't know where they're being broke down, and same thing with, you know, it's, I don't know, you know, we deal with enough, but having to come here all the time, and the option's always there. Take the task force, move it somewhere else. But, you know, when you got something constantly and then the oil is used to that protocol, you need to respect that. And then not only that, cleaning supplies. The cleaning supplies I give to everybody that calls. I mean, I have compassion for the people here too. I mean, I'm from here. One day I might be on the other side of the fence and want cleaning supplies. So I always take that into factor, that one day I might be them. Just because I'm in a position where I can decide who can get a food card and who can get us cleaning supplies, my compassion goes very great for the people. And even though, you know, they're not COVID positive, I'll give them cleaning supplies. You know, and I have my runners that go drop it off, so I'm not putting that pressure on CHR or the tracers, but they get cleaning supplies. They do, because I want people to be safe as well, and we give them masks and whatnot. And, you know, I'm just sitting here based, you know, everything's based on hearsay, but nobody knows what we're doing because they're not in our shoes. And, and so, but.
Close, so I can, we had Steven share.
So, I guess, you know,
This is Abby, can I get, or
that people not doing their job. When I say that it should be an office of its own, we're in year 2. And it took 2 years for me to see a draft. And that wasn't done by this office. We should have stats every week. You guys right here should have stats every single week on where we're at. What's the hot spot? What are the families? Who do we need to focus on? In every single community, we should be able to bring that up. That how many are dying from medical issues? What are the ages of people dying? All of that stuff. How many kids in these schools are positive? Which schools, which communities are they from? All of that stuff should be in a report, a weekly report. And you're dealing with sick people. And I never said that they aren't doing a hard job. I always say that they are overworking. They're busy. They are really, really busy. I see that all the time. Maybe it's too much for that office. Maybe you form an office and move Styla. You tell Styla on there if that's what he wants to do. But somebody needs to be focused specifically on what's going on today. And you guys, of all people, decision makers of the tribe, need to be well informed on what we're doing, where we're at, and what we're going to do, so you guys can continually plan or have a plan in place, not wait till next week or next month or whatever to do a plan. That information should be there in front of you each and every time you have a council meeting. If you have an issue, you should be able to bring it up every single time you have a council meeting. If you want to keep it under her, get her more help. I said that too. Either way, you need somebody specifically focused on this. It should be somebody with a medical background. That's just my personal opinion. Skyla probably knows in the CHRs, in the tracers, they probably know more about this virus than most people. Because they're dealing with it day in and day out. Are they doing the right things? I have no idea. That's not what I'm here for. That was just a suggestion from me, because the communication that I have in my office, at times, not going to say all the time, because she always answers her phone for me. But the tracer office is a different story. I cannot get through, and I call every single phone number that's listed there. I can't get through. I have to call Skyla and tell her, and I tell her every time too. I can't get through to them guys, so I'm bothering you. Can you get me this information? One instance was the example Sherry used yesterday, on a positive that our officers were involved in a domestic situation. And they didn't know if this person was positive or not, and she turned out she was. They had already taken her to jail by the time we got a call back. But that information should be ready, available, to not just law enforcement, ambulance service, but either one of the correction. Because we're dealing with them hands-on, face-to-face. And the last thing I want to see is catch that virus and take it home to their wife and their children or their grandma or whomever it may be, and they end up passing or getting really sick or suffering. You don't know who has underlying medical issues. I don't. But that disturbs me to know that we can prevent something by communicating better. And right now, we don't really have that.
Yeah. Yeah. Neil?
We have a motion on the floor. Can we vote?
There's still needs to be some discussion on the motion. We still having questions on the casino. Does the casino close down? Can we afford the casino to close down? How does that look like? We also had a question on school activities. Are we gonna let those allow it to happen, or get a schedule of activities and let them happen, or is it just a shelter in place from school? There's still some questions that need to be answered, I guess. Pam?
You know, I think, our whole entire first responders are all overworked because of this. And the shelter in place isn't gonna fix it. The reason why I say it's not gonna fix it is because there's that curfew that's in place. That's gonna tear up his curfew, his officers, which are already tired and worn from trying to keep meth down. Same thing with our EMS department. I haven't heard how many are sick from his department yet. But I know he's short-staffed anyway. Our CHR programs, same thing with them. They're one of the ones that have to go out there too and be face-to-face with everybody. But I don't see this. I don't see this shelter in place because a lot of our people are going to move no matter what. Still going to send kids from households to school because some don't have food at home, so the best place they're gonna get food is at school. Some just don't, I mean, there's just, the tribe just does not have the resources at all to be trying to act like we can take care of this. And I thought we were gonna sit here with suggestions and not start throwing motions right away, but it sounds like we're gonna rush into this and hurry up, make motions. Our casino can't close down. We talked about this before. Closes down again, there ain't no way it's coming back from that. It's barely trying to survive right now, barely trying to keep people employed over there. I don't know what we're gonna do there. We have no authority over Todd County and White River schools. I don't know why we would even think about trying to say anything about sports, because the only one that's gonna be affected is St. Francis Indian School. That's the only one we have authority over. So I think we need to have more discussion before we start throwing motions out, trying to come up with plans, something. I mean, yeah, they sat yesterday and talked about doing this and that, but on the other side of that, people that weren't there have questions themselves, and then it takes it in a different direction. I don't know, do we just need to talk some more, or what needs to happen? I don't know what to say either, but I can't support a shelter in place. I really can't, because our people want to move. It don't matter. Even like this curfew. During this curfew, how many people have you stopped?
For the most part, people abided by it. There were a few cars out there, but, the initial, memo that went out was kind of unclear. I discussed that with Scott, so we didn't issue any tickets because of the unclear motion. People were confused. So we stopped people in town to go home, but we didn't issue any citations.
So I guess I mean, when he talks about having something clear, that's what we need to do, is have something clear. And it has to be fair across the board for every single person here on the reservation. If we're gonna do a shutdown, we gotta shut down our schools. Gotta shut down that casino. We gotta shut down IHS employees, because you know what? We have some tribal members that work at that facility. They don't reap no benefits that the tribe does, because they're government employees. During their time, if they catch COVID, they gotta use their own leave. And if they don't have leave, then it's leave without pay. There's a lot of things that we have to discuss, and we have to be fair to all our tribal membership that lives here. Now, what about, nobody's ever had that discussion of what about the ones that come in from out of town and stay here for a few days? They don't understand our laws. What are we doing with those? So, I don't know, I think there needs to be, we can go ahead and do something with the task force and give it to somebody. But either way, there still has to be somebody in the health field that has to be in charge of that to understand what pandemics are.
Yes.
So thank you.
Jordan?
I'd just like to move the table so we could get a plan, like for the funerals, things like that. I had to bury my grandpa during the pandemic, and it was hard because we went straight from the funeral home to the grave site, and I don't want to have somebody else have to grieve that way because it's stressful. And also our schools, like Pam is saying, our casinos, we got to make a better plan before we jump into this. So I would like to move the table.
Thank you, Jordan. Council, I do have the policies and procedures that were created during the first.
Got a motion to table, need a second. Second by Dwight.
Shelter in place.
Question by Lisa. Motion to table the shelter in place. All in favor?
1, 2, 3, 4, 5, 6.
Online, Bill?
Bill, yes.
Stan? Micah?
Voting no.
Donna,
Yes.
Dara,
No.
Eileen,
Yes.
Tennille,
No.
Wayne,
Yes.
opposed. Two online, there's two.
One.
One and two online.
Three.
Three.
Opposed. No.
Three opposed.
Three, four opposed.
Four opposed.
Yeah.
Not voting,
Yeah, so.
What was the number?
what was the count? 10, 10, 4, 2?
10, 4, 3.
10, 4, 3.
17 total.
Motion carried. Sheriff, and then Russell.
I know that, I'm being shunned for, making motions, but I want to make another motion to direct the chairman to contract a task force administrator to begin, issuing or addressing the following issues: public relations and public education, occupancy and trailer maintenance, inventory and distribution, supervision of the tracers, data, vaccination scheduling with IHS and testing, and policy creation.
Okay, we need a second. Jordan, read the motion back so we're all clear.
Yeah, stop it, yeah.
Sure, can you read it back again? She didn't get all of it, so.
Okay. A motion to, contract a task force administrator, has a medical background, and their scope of work to include public relations and education, occupancy and trailer maintenance for the COVID trailers, inventory and distribution, tracers, vaccination and testing collaboration with IHS, to work on policy, developing policy.
Yep, got it. Any discussion?
You wanna include other duties that, you know,
Assign.
forthcoming as
It's a good
as we
suggestion.
develop.
Thank you. Please include, Russell's suggested amendment and Councilman Eaglebear's suggested amendment.
And if we contract it, can we make it pay negotiable or something like that?
Yes.
Okay.
Concha, from looking at the past, from 92 to 2005, we had a kind of like a plan in effect that worked. When it dealt with disasters, Lino Spotted Elk was the one who brought it on. It was an incident command. It was sort of like a disaster response. It had all, the components in it. It mainly provided for accountability. Now, COVID isn't going to stop in 2 weeks, and it's probably not going to stop in 5, and it doesn't stop for holidays either. He implemented something that worked quite well back in the day. There would be a command center, manned 24 hours a day. It would include finance, the logistics, transportation, public relations, everything that Sherry's kind of talking about right now. We're in a position where, we're just filling around in the dark. But, we can look at the past at what worked and what didn't work. And right now we just seen a suggestion get thrown to an administrator or a program director, and we seen it kind of, it aroused some anger, and we seen the effect come off. Everyone on YouTube watched it. We don't need that. We need people working together. And if we have to look at the past, if we have to make a new motion to bring in new things to make it work, we need to do that. So I'm down for this motion. And maybe we can look at the incident command that we had in place back in the day, because, if something worked back then, maybe it could work today. Thank you.
Are we in discussion, Chairman?
We're in discussion.
I have a comment. I received a comment from a director, and I think that no motion supersedes any resolution, and with resolution 2020-75 being reinstated, that is your authority as you seem fit, and I think you should follow your directives and recommendations from the task force that historically has worked well for us. Thank
you. Jordan?
Thank you. I feel like we kind of tend to think that we're trying to take jobs away when all we're trying to do is provide additional support. So we're not trying to take that away. We're just trying to give her extra help and extra hands and extra eyes. That's all we're trying to do. We're not trying to take it away or make anything like that. We're just trying to have support there for her. That's all I would like to say.
You want this advertised?
We're stimulated.
It'd be, you would think it would be advertised.
Russell, did you still want the floor? You wanted the floor before the motion was made, so I don't know if it was about. You still wanted the floor?
Yeah, I think we, somebody mentioned that, I understand that the task force met yesterday, so they have a meeting, they should have a kind of a idea of the discussions they had and recommendations to this body, but we just hear it, and then we get blamed for not attending the meeting. But we are legislators, we're not program developers, we're not supervisors of these. That's your responsibility. So anytime there's recommendations that are coming up from these meetings, they should be presented here in writing. Some of us aren't, well, me, I can't say some of us, but I'm not phone literate, or I don't do the things you guys do here on a daily basis, communication wise. It would be nice to look at something on paper so that we can read it and digest it. And I just had to ask this young man over here about what a hybrid school, their policies are. And he explained it to me in layman's terms, which I understood. That again, that's going off in this phone world, and I didn't understand it. Now I do. The policies for these schools in terms of hybrid. But anyway, I was going to mention that, and I think we need to take a break and take a breather and then come back and jump right at it again.
Thank you for saying that, Russell.
Okay, we had a motion on the floor. We had a second. Is there any more discussion on the motion? If not, we'll vote on it.
Motion by Sherry Wright Plank to search a contract for a task force administrator with a medical background, pay negotiable with a scope of work of public relations, education, occupancy, trailer maintenance for COVID trailers, supervision of tracers, inventory, distribution, testing, vaccine with IHS, policy creation, and other duties as assigned. Second by Jordan Ron.
Adam, you have a comment?
Yeah, I guess, my question is, where is this money coming from?
From to pay this person.
I'm guessing it's coming out of ARPA money, so there has to
Are
be.
we guessing or do we know?
I don't know.
Okay, well, if we don't know, then that's what I wanna know is where is it coming from?
Okay.
I'll make my motion for the treasurer to find.
Chairman. Chairman.
Donna.
I'm gonna vote no. I'm gonna let people know if we're on the radio, because I think every one of these job description, or every one of these, bullets that should, can be done by this task force. And, you know, as leaders, we're all looking for each other, for the help, and that's what we need to do. So if it's not working right, we can fix it. We'll get the task force. They need to meet. I guess they meet once a week. Maybe they need some compensation to meet in the evening where it doesn't interfere with anything, but that's my vote. Thank you.
Lisa?
I'm gonna vote no also. I passed out the resolution number 2020-120. And in that resolution, whereas RST has mobilized the COVID-19 task force to include the Rosebud Sioux Tribe Law Enforcement, the Rosebud Sioux Tribe Health Administration, as well as the CHR office in the fight against the COVID, or the spread of COVID-19. So the task force is to be, you know, collaborative of those three entities, and then they bring recommendations or plans to us. Also in this resolution, that therefore be it resolved that the RST Council does hereby identify and authorize the Health Administration as required by 45 CFR as the entity that will collect and receive PHI that is related to COVID-19 pandemic. So we already have this process in place under a resolution. I think we need to go back and take a look at that, and if, you know, if it needs to be re-looked at, we talk about having a plan, needing a plan, but who's gonna facilitate that plan and bring it to us? Who's gonna put that plan in place? The other, therefore, be it resolved that those persons working within law enforcement services, RST Prosecutor's Office, RST Correction Services, CHR offices, and others engaged in public health investigations, public health interventions, and public health surveillance are authorized to receive that COVID-19 diagnosis information from the Health Administration for the limited purposes of preventing the spread of COVID-19 and enforcing the laws related to mitigating the spread of the communicable diseases in general. So this is already in place under a resolution.
Also, Chairman, the job description don't exist and the position is not budgeted into any existing budget.
Okay, so we're gonna have to pay the job description with it, so. Sheriff?
Thank you. So this council supersedes any committee. Any motion made here, this body has the authority to do that regardless of it going to committee or not. Because of me being new to this council, I get told so many times to go back to committee, and I respect you all, and I do that. But today, this has been going on for too long. This isn't a slight at our health administrator. She sits here and gets chewed out by everybody. This is to assist her. The implementation, who's gonna implement that, to answer Councilwoman Whitepipe's question, if this position gets passed, this person will write it and implement it. This is the piece that's missing. And the reason I'm bringing this forth is because I joined the task force recently. I have sat down, looked at data, sat down, wrote things out. It takes time. That's time away from a tribal director. And to address Councilwoman Hollowhorn Bear's issue. You know, all of the people that are on this task force have other jobs, and they're not just, you know, small jobs. Our chief of police, our people from IHS, our RN who's helping run the testing, they did 200 tests yesterday. Think about that. Our health administrator, who doesn't just have COVID on her plate, she has 7 other programs. We have our CHR, who they also have their other duties. So we are overloading a specific amount of people who already carry a heavy burden. I think that this position would support that office and it would support our cause. And they can address those issues that Councilman Eaglebear brought up about burials, the issues that Councilwoman Ron brought up about education, and the other issues that people have, or about childcare, sorry, and the other issues that people have about creating a hybrid draft. So if we need to take and amend that resolution, then maybe we should do that. But I do think this position needs to be here. It needs to be implemented. So somebody is working on this every day, that's not their only, that it's their only job. And it's not just a side job or an extra duty, or it's taking precedence to their regular job. How many health complaints do we have out there that aren't getting addressed? How many other issues are out there that the health administration is dealing with that aren't getting handled because COVID is taking over all of that? So I just want to say, I think this position is good. It's a good idea. And I hope that you support it. Thank you.
Okay. Call for the question.
I'll question.
Micah, all in favor?
1, 2, 3, 4, 5.
Online, Eileen. Bill,
No.
Stan. Micah,
Yes.
Donna,
No.
Daryl,
Yes.
Tennille,
Yes.
Wayne,
Yes.
opposed,
1, 2, 3, 4. I got 10,
4,
no, 10,
4 opposed.
10. 2 are not voting, in fairness. 6 and 1 not voting. So 10, 10, 6, 1.
Motion, the count is 10-6-1, motion carried.
Chairman, could we get a legal opinion to find out if this motion's out of order, being that we have existing resolutions and as per the Constitution, no motion supersedes a resolution?
Sure, you can get, Eric in here. Russell,
Yes, I was gonna make a motion. Since we are legislators and we have to follow the laws of our tribe, this motion can be incorporated into a resolution to be brought back here for ratification.
Okay.
And I'm asking for a lunch break so that we can determine, we'll take the treasurer into the corner and find some monies, resources, so that we have a plan in place when we come back into session.
okay, we're gonna take our lunch break, Russell, can you do the bill prayer before you?
Sure. Yeah, we always remember, our relatives who are in the spirit world, and we always acknowledge them through prayer, especially when we're gonna partake in meals. But right now, we also have some of our relatives who's making that journey into that spirit world. And it's really sad that some of our families are hurting and grieving. And so we say a prayer for them because sometimes that's all we can offer. So I'm gonna remember them through this prayer. Thank you. Oya tukashila, akantu shniwota kuyo machata yampiko. Ampetu kile unshike ohina jipina hoyo ni chapi. Namitaku e ani chitke o trunko akamanipi, hoyin kai yushke ichaki tupo, niyesh o washke washta wichag bogalapikte. Alampetu ki avoite ayuin api, avoite ayatun kapi, tonka Muzani Uchimpi. Na ya Och jag tycker att when you think this. Ja heitums alle an betuki onsit ja hoiet chapelo osunkilla po homi takue ojasin. Thank you.
What happened to
It's not a pretty sight. Still going on. Some people have a lot of long effects afterwards. In order to help get herd immunity, we need to get vaccinated. We need to quit thinking that we're invulnerable because we're Lakota. This is not a Lakota disease. This is a Washichi disease, a white man disease that was invented.
tale of John Trudell. This is spiritual awakening.
Schubert telling him to get back. Trying to downplay. The booster.
And I can put something on our Facebook page again, just to let everybody know. I talked to somebody else about that this morning too, so I can put that notification on there.
And that age was up to?
12 to 18.
Kelly, earlier today we was talking about PSAs and stuff. What is IHS doing as far as PSAs? Are they getting anything out there, or can you do that, or is that beyond your?
No, we can do that, and we had discussed that previously too. I think those Q&As were very effective in communicating with the community. So we'd like to do those again. So it's just collaboration, setting up a date and time, and we'd be glad to do that.
Okay. That would be great if you could do that. I know I encourage some of the council people to do a PSA as far as encouraging them to get vaccinated, and some of them have. I think that's a good thing that they're doing as far as getting it out there. So
yeah.
And I know Dr. Tolby said he would do one if it was, whenever we needed him to do that. Yeah. So hopefully we get him out there, get him on the air. Anything else for IHS?
Russell?
You guys need to improve your place of vaccination or testing. The other Friday, I went up there, I saw that door wide open, nobody was there, but they were in the middle of a move to the diabetes department. And it was windy, cold.
It was really cold.
And so you would think after a couple of years of this, you'd have a nice structure to be able to keep your workers in a safe environment.
Yep, I've addressed that, and our safety officer says he has stuff ordered to build something like that for us. It'll be a couple weeks, but like a drive-through that's more protected is what he said.
Right.
So.
Thank you.
So was you guys actually inside the dialysis building?
What they're doing is, so everybody can just stay in their vehicles. They just crack it open, then we have some big heaters in there. So like the garage doors open like quarter of a way, and we have our stuff set up in there. And then the staff just goes out, visits with the people, have them fill out that form, and then they can just swab them while they're in their vehicle.
Not in the dialysis, the diabetes. They have a garage.
Oh, yeah, DPP, the drive-through. They just go around back and that way. So we're doing it till 10 at night. So we're gonna look at it and see how many people we serve. We might need to adjust our hours, but for now it's 10 p.m., 9 a.m. to 10 p.m.
So I guess can you kind of explain what the procedure is for getting vaccine, getting booster? I mean, I know that you guys talk about doing PSAs, but right now everyone's paying attention to this meeting. So I think if you can kind of explain what those procedures are, where do they go, how do they check in, who do they contact if they want a booster, all those sorts of things. I think that would be good.
Yeah, I think that's a good idea. COVID vaccines, we continue to have all three. So we have the Pfizer, which goes ages 5 and up. We have the Johnson & Johnson, which is 18 and older, and then we have the Moderna. So we offer all three vaccines Monday through Friday at the hospital. You can park and come through the front doors of the hospital. We ask that you stop at patient registration to update at least your phone number. So if we need to make contact with you, we can do that. After you are done at patient registration, go over to the elevators and you go up to 2nd floor and take a right, and you'll see there's arrows on the wall. There'll be nurses right back there that are offering the COVID vaccine. So if you have questions on that, you're welcome to call the hospital. You can ask for myself or Sammy Wan. We have our cell phone numbers posted on our Facebook page too, so people are welcome to call us. I do get calls pretty frequently in the evenings, weekends, which is good because then people are inquiring about it. So we're glad to help in any way that we can. For right now, that's what we're doing. We're going to look at maybe taking one of those days and going to the communities, but we'll have to look at our numbers and stuff first. Testing for right now, testing is Monday through Friday from 9 a.m. to 10 p.m. That's at the DPP Wellness Center here in Rosebud. Just when you come, just go to the back of the Wellness Center and you'll see a line there, and we'll have staff members that can come out to your car and swab you.
We have Lisa on that, Pam.
I know, Kelly, I spoke with you outside and I didn't want to make it an issue, but last Wednesday I went after 4 to get my booster, and I went to registration. They told me to go upstairs. I sat upstairs for about a half hour. Finally, some woman came down and she said that, I said, I'm here to get my booster. She said, they're not giving them anymore and come back. So then the next day, I went on Thursday, went to registration, got there at 3:30, and was basically told they only do them from 10 to 3. So maybe that needs to be communicated out there to let because I didn't know what the hours were myself. I just didn't look into it. But if, we have employees that are working, if nobody can make it up between 10 to 3, then where do they just have to try to make it during that time frame, or can they?
So first, I guess I apologize that happened to you. I encourage anybody to reach out to me if they have any questions or concerns. I'd be glad to help. Currently, they should be doing vaccines from 9 until 4 p.m. After 4 p.m. till 5 p.m., patient registration should put that person on a nurse-only visit, and then the outpatient nurses can serve them from 4 to 5.
And then you just go to regular clinic on the first floor?
Yeah.
Okay.
So I can put something on Facebook again. It's been a while, so I can provide that again. So.
Pam, and then Vanessa, and Steve.
My question, I guess, was on the journal. You didn't say COVID. J&J was 18 and older, and Pfizer was 5 and up. Moderna is what?
Moderna was 18 and older, but I need to check because I think they were working on switching their age. So I can check and let you know. It would either be 16 or 18. Let me double check. And like with everything else, there's so many changes and fast changes. So things can happen and change each day. So it does get overwhelming at times, but everybody seems to work well together and have patience, especially the people coming through the drive-through. I know those long lines get long, but the feedback from the staff that I'm getting is that everybody understands and seems to be really patient. So we do appreciate that.
Also, I did know that I believe the FDA and CDC has approved a bill for this COVID.
That won't be released till, I think, almost towards summer.
What is that bill for?
Got pills for,
the antibody pill.
Yeah.
I don't think, yeah.
So I just got an update on that this morning because I inquired about that yesterday for a gentleman that tested positive for COVID. The antibodies for the Omicron will be forthcoming. The oral medication we should be getting, I believe, the acting clinical director told me sometime today. Somebody was driving to Eagle Butte to pick up some of the supply.
Is that Paxlovid or pill?
I don't know the exact name of it yet. I haven't done any background on it yet, so we'll provide that training to our staff once it arrives. And to answer your question, Moderna is 18 and older.
Vanessa, did you have a comment?
Yeah, I just wanted to ask Kelly to inform the public about, like, when our, people that are not vaccinated and get COVID, how many days or weeks can they go in to get their vaccination? That question I asked for a younger child.
Yep.
But if you can just do that for all.
Sure. Should always follow up with your primary care provider, but if you had COVID, you completed your isolation days and you want to get vaccinated, either first dose or your booster or second dose, you should follow up with your primary care provider, but you'll want to make sure you're symptom-free, no symptoms. So like say you had COVID, you had body aches, cough, congestion, you would want to make sure that your symptoms have resolved or completed before you get your first, second, or booster vaccine.
Steve?
Yeah, my question is, do you have a choice as to which vaccines you're gonna get, or is it what's readily available, or?
We have all the vaccines, we have plenty. I usually watch the amounts and I can place an order and we get it pretty fast. So we should be asking each person which vaccine they'd like to receive.
Okay, thank you.
You're welcome.
Any more questions for Kelly? Russell?
I hear, again, it could be rumor, but I hear that they're doing some kind of a transfusion technique at Pine Ridge for the antibodies. Can you explain that and what's there?
For antibodies?
Yeah.
Yep. We do have infusions available for antibodies. I have worked with several community members that are COVID positive. I work usually with the hospitalist to get an order for the antibodies. We have never ran out of those. So if somebody is COVID positive and they have antibodies, they just need to contact us and then we'll work with the hospitalist, and then usually we'll bring them in like after clinic hours. So they're not exposed, and then we go up to our hospital floor and use a room there so they can relax on a bed, because the infusion takes about 2 hours. So we do have them available for people. The current antibodies that we have were for the other variants other than Omicron. So that's where we're supposed to be getting those other antibodies.
So who's like, so who's eligible for these infusions? I mean, do you guys like have a priority as in underlying health issues first, or maybe a teenager, or who, I guess, or is it just anybody that comes through and says they want an infusion?
Yeah, the criteria. So I've had people just reach out to me and ask me for the criteria. I put them in contact with a provider. The provider will visit with them, and based on their conversation, the provider would recommend or not recommend them to receive the antibodies. So comorbidities such as high risk, so like diabetes, hypertension, maybe if somebody's immune system is weakened. So there is criteria to meet, but the provider discusses that with the patient.
So this provider, so if I wanted an infusion, do I have to make an appointment in order to see a provider, or when I come in and go up for the shots or whatever, I say I want an infusion and then you guys send me to a provider? How does that process work?
We have received orders through our outpatient department. So say somebody has an appointment with their primary care provider, they test positive. The provider can discuss the antibodies with that patient right at that time, and then they'll reach out, and then I usually coordinate it depending on how busy the outpatient or how busy our inpatient is, and then we'll get it administered for them. So like when the task force was doing the testing. If we had a community member that was positive, a lot of times they would give them like my number, they would call and ask about the antibodies, how that works to get those. We've had people just calling the hospital. So there's numerous ways they can do it, but we could standardize it to where there's just one phone number somebody would call. But I'm always willing to help. You know, like I said, everything's changing so fast, and staff, you know, are out, so we're kind of stretched thin. But we're willing to adjust to what we need to do to serve our community.
Okay, any more questions for Kelly? No, thank you, Kelly.
Thank you.
Scott, I have a question. This is Micah.
Micah, go ahead.
Kelly, just a question is in regards to our state hospitals and with, you know, this huge rise in our COVID numbers, how many of our state hospitals are accepting patients regardless if it's COVID related or other issues? How many of them are accepting our relatives into state hospitals?
Yes, our tertiary centers, we mainly use Sanford in Sioux Falls, Avera in Sioux Falls. We've utilized Avera up in Pierre, and then up in Rapid is Monument. So it just depends on the day, the time of day. There can be an influx of patients, so each time the provider calls to get an accepting provider, that's when we find out if they have any beds available for what the condition of that patient needs. And to be honest with you, recently, all of our outlying facilities, the ICUs are full, not just with COVID patients, but with other critically ill patients. And that's national. We have, once within South Dakota, there's no beds available, then we start going to outlying states and just kind of work our way out. So at some facilities, they'll put our patients on a wait list, and then they'll call when they have a bed open. But for the most part, we just keep going to like Nebraska, then North Dakota, Wyoming. So it just depends.
So as of like today, a lot of our relatives, just, you know, regardless of the issue, are being flown out of state.
Some are and some are not. I would have to look at the numbers. We are usually able to get them into Avera. I know Monument was on diversion for a little while, but we're usually able to get our patients into Avera or like HSC in Yankton. Sometimes we can go up to Pierre, but our goal is to keep them closest to home as we can, so we try to do in-state.
Okay, thank you, Kelly.
Kelly, can you please explain to the council what you mean by diversion?
Sure. Yep.
You know that HS goes under some kind of status, and diversion is one of them.
Yep, it's rare, and we need to work with our area office if we need to go on diversion, which means we would not be able to offer a service that we normally offer. We keep a diversion log at the hospital, and like I said, work close with our area office, but like Rapid, being on diversion, that means that they're not accepting any patients at that time. So we won't be able to call them and be like, hey, can you take Mr. So-and-so? And they would say no because they're on diversion. They're currently at their capacity. So then that's where we have to start calling other facilities too.
Has Avera made any mention of possibly going to diversion based on number of cases that they have in Sioux Falls facilities?
To my knowledge, at this time, I have not heard anything in regards to Avera potentially going on diversion.
Any more? Not then. Thank you again.
Thank you.
Any more questions for any of the task force members? We have Skyla, Eric, and
Dina back there. Russell?
Yeah, I have one question. You know, when we established the task force, we had a whole list of people, names on it. And the question I put forth was, well, who's the core, or is it a small group of people that meet the task force? Or is it this whole group? And I'm hearing back that it's just a small handful. Do we need to reset the task force members?
Skylar, you wanna talk to that as far as who's on the task force, which departments? I know you and, Eric have been a really big part of getting these meetings together. IHS shows up at the meetings. Eric from the ambulance service, law enforcement shows up, IHS shows up. So it's.
On March 16th of 2020, when we established the task force, the council at that time, approved the organizational chart and the task force plan. The motion by Kathy Woodknife to accept a COVID-19 task force work chart and tribal programs task force plan. Entities follow it and it can be modified as needed. So this is the work chart right here that was approved by council then. And then following that resolution that I read off, that was it 2020-120. It lists the entities that should be involved in the task force.
Can you read that for the council?
I passed out the resolution?
Yeah.
I passed it out to everybody. Okay. 2020-120. Here's the.
Okay, so when this was developed, it was, I don't know if you can see it, but it's the point of contact is the health administration office, then it branches off to our health programs, which is EMS, CHR, Robert Oliver, Indian Health Service, the public programs, public safety, community services, finance. And then over here, it has the 20 communities. So when we do the letter of invite, it's sent to all the people on our phone when we do the task force invite. And on there is Melissa Eaglebear, Robert Oliver, Dr. Toby, myself, Steve Denoyer, Scott Herman, Lisa Whitepipe, Sherry, Dina Begay, SWA, and IHS, and Eric himself. So a majority of these people, we do I think the ones that are real faithful to the meetings are the health programs, and occasionally Lisa will get on there through Zoom, but it's up to these other people to attend on their own merit. So.
Define occasionally.
I know when the
I don't want her to micromanage them. I just want her to need legislative support.
Yeah, I mean,
if they need legislative support, they'll call and.
I know when the numbers went down there for a while,
There was not that much testing being done, and the numbers went clear down, and the task force didn't meet as much. So as soon as the numbers started coming back up, they started meeting on a regular basis again. So
I have a comment or a question for Skylar.
Go ahead, Steven.
Skylar, knowing all of the policies and procedures that were developed by the task force previously with under the previous administration, the policies and procedures that exist, and the attention that I think we can give from the task force through the president's authority in 2020-75, do you feel the need for a position to oversee that, or any changes being made to the current structure? I think we can re-implement some of the policies and procedures that already exist.
So what we do with the policies and procedures, and they were handed out to the last administration, and then we had to update. And we updated the last time was October 31st, then we turned around and then we updated to include, because we're policing our own policies instead of listening to the state and CDC, is that we went from 5-day quarantine and isolation to 10 days for both. So that's what we hurry up and we put that out there, and I put it in the newspaper so the public, the general public would know about those changes. So I don't know, in my opinion, like I said earlier, but I don't want to sound like I'm trying to be a scorned, cast member or whatever.
Definitely not.
And, but earlier on, I stated that, you know, changing hands midstream in the middle of this pandemic is kind of detrimental, but then again, you know, the motion passed, so, you know, what can I say anymore, you know? And the other thing that's being asked is where is this gonna be funded from? And, it seems like we take a lot of criticism from not just the public, but also, you know, we get a lot of, concerns from council that are brought to the floor.
Absolutely.
And, but at the same time, earlier on, and I want to apologize to the Oyate and to the council if I came off very defensive, but from day one, it's always been that way for the task force. And I've always had to go in the defense mode all the time to defend my task force.
Mhm.
And I apologize for my actions earlier, but at the same time, we should be given, you know, a little bit of respect because we deal with a lot.
Absolutely.
And I know everybody's looking out for the best interests for the Oyate at the same time and the employees, but you know, and because we're supposed to be the voice for the Oyate at the same time. But at the same time, we need cooperation from the public or, you know, the Oyate at the same time because they're the ones that need to comply when we're trying to enforce something. And we don't get that participation. And it poses a lot of extra work for everybody, not just the task force, but law enforcement, EMS, and IHS. And I really think, you know, the momentum that's in place now needs to just keep moving forward. But like I said, you know, my words or our words didn't hold any weight earlier on, and the motion went through, it got passed. So in that sense, we're questioning where's the funding gonna come from? Where's that person gonna be housed? Who's gonna supervise that employee? And so those are questions that I asked Sherry in the hallway, you know, because it wasn't very clear as to what was gonna happen.
Absolutely.
And you know, to draft up a resolution for it, I don't know. So there's all those things that need to be worked out. But meanwhile, we'll still be carrying out these duties for the general public and just kind of go from there, I guess. So, but I really think that at some point, some gratitude should be given to our task force, regardless if we made anybody happy or we disappointed people. But at some point, some kind of gratitude should be given to the task force, regardless of how this all pans out. And you know, whichever way it goes, you know, we'll walk away with the grain of salt and just continue on with our lives, you know. And but I really think that we carried a really heavy load on our shoulders, but we never once complained. But everybody else complained for us, so you know, it's kind of like I really think that, you know, we did the best we could. I mean, honestly, we did. We never complained. We took, you know, all the constructive criticism that we could, and I apologize that we didn't meet council's expectations and whatnot, but that's to be expected because no matter what kind of plan you have in place, it's never going to be perfect. And I'm sure you'll find that out if this new position gets funded and whatnot, which we dealt with, will probably still be the same concern. So, I mean, it's what it is. It is what it is.
Thank you for your answer, and I agree with you, Chairman. I don't think we should reinvent
the will that exists or negate any policies and procedures that have been developed. Thank you.
Okay. Any more questions for the task force?
I have a question, or not a question.
Go ahead, Donna.
Again, yesterday I commended the task force and all the programs that are running while we're under this pandemic. There's no reason for the task force to apologize for anything. This is something new to everybody. The only thing that we ask is for people to do the PSAs, to inform them, to get vaccinated, to get tested, and do our own family stay-at-home shelters. I'd like to just share that and commend everyone for all your questions and to keep up the good work. Thank you.
Thank you, Donna. Any more questions? Russell?
Yeah, just from listening to some of the comments being made here, last week, I didn't get an offer or a chance to come to the meeting personally. I listened to you on the radio, the telephone. But one of the things that, what it boils down to all the time is money, or paying somebody, or not having enough personnel to do this or do that, or, or being overworked, so we want to do a pay increase. I mean, that seemed to be what the gist of that meeting was last week, where I think a motion was made to, and I don't know where it came out of, from health admin carryover fund to do that very thing. But as part of the planning, we need to plan ahead, and if you want to use additional funding that is carryover money, shouldn't you use that to improve the program itself? I mean, that's a common sense question, but it seemed like, the whole course of the meeting last week ended up doing that. But in the whole planning process, if you're short on staff, if your staff is getting burnt out or they're leaving because of pay, shouldn't you hire additional personnel, or at least somebody to answer the phone? And that's the communication portion of it. It gets on people's nerves when you try to call somebody and they don't answer the phone, especially if it's a tribal program that's supposed to be open, or tribal officials sitting up there that, you guys ran for these offices, so answer your phone. Plain and simple. That's common sense. And that's what people are expecting. So I guess that's kind of a two-way question, for me. That's why I say, is it funding? Let's talk about that funding. If that's what it's going to take to move into a positive realm, instead of this, talking about the same thing over and over at meetings, and like I said, 2 years from now we'll be sitting here talking about the same thing.
There was a motion made last week to give increase of some type of supplemental to those health administration programs. That was including ambulance, and it's supposed to have been came out of their carryover, so there was no mention to using ARPA funds, but it did mention that we had to use carryover funds from health administration programs. And you're right, they should be used to improve the programs or deal out services. So, I'm the chairman up here, and the motion was made. I didn't stop it, but I didn't think it was wrong or right. But I think we should talk about supplementing these people that are on the front line a little bit better than we have been. And there is burnout going up on her, and I'd like to maybe have Eric talk about his ambulance service, as far as what they're doing up there. Dina, CHR, delivering all the food and the supplies to the people who have COVID, what's that like? And I'm sure they deserve some type of supplement, but where's it going to come from? And I don't necessarily, if we do for one, then we're going to have to do for everybody. So I'd like some of that discussion to be happening today, as far as supplement, as far as Eric's program, as far as not getting the supplement that he said he was going to get from that motion, because there's no carryover funds for him to get it. And so that doesn't mean that he doesn't deserve it, or his workers should be not getting it, I think they should get some type of supplement for what they do.
I just got a message from the program director up at the solid waste, and they're consistently getting sick from dealing with the trash. And they're refusing to pick up any COVID trash now. They don't want to do it anymore. And so there's issues like that out there that I have to deal with. And so I'm just saying that maybe we should discuss this a little bit more in depth on how we're gonna supplement these programs that are on the front line. I'm not saying that everybody should get it, but I think the ones on the front line should get it. Oh, go ahead, Eric.
So, I didn't really hear about this motion or resolution until just recently, until actually Nicole emailed me the excerpt the other day. And, seen it, I mean, we don't have carryover. The ambulance service never has carryover. I mean, I should say, we don't have carryover from our $638. We never do. We struggle every year, as you guys know it. I mean, historically, it's always been that way. We struggle to get by, recently, in the recent years, or I guess the way it's always been. CHR, Health Administration, we get together and we make it so that we can finish to the end of the year. Our third party, yeah, it has a carryover. We had a pretty decent amount of carryover. We had over $100,000 in carryover this past year, but that's nothing compared to when you talk about our payroll. I mean, our payroll is anywhere between 55 to 60,000 a pay period on a good week, on a I guess normal week. When we talk about holiday pay and you add in this hazard pay, that jumps up $70,000, $80,000 pay periods. So these things add up, and increasing that $5 a wage across to all our employees. Do I feel that all my employees receive a $5 raise? Of course. I think every one of them work very hard and are diligent every time they come to work and put themselves out there at risk since this whole COVID started, and even before that. We were always exposed to other viruses and illnesses. I mean, we talk about TB and AIDS and HIV, hepatitis, HIV, all these other ones. That's always been a risk. COVID was not something new. I mean, it was something new, but it was just one of those other things that, hey, we could be exposed to COVID. It's something that's always been there, and I agree that yes, they should receive the $5 raise. We talked this morning amongst ourselves to figure out, what can we do to strategize to make this work, not just for EMS, but for Health Administration, for CHR. Our carryover isn't that large. I mean, the end of our contract year is up this September 30th, and we enter a new 3-year contract come October 1 of 22 for FY 23, 24, and 25. Just looking at what we had talked about with area office before Christmas, there is no new funding. There is no new funding out there from area office to increase EMS, to increase CHR, to increase any programs that are already existing. So knowing that going forward, and just looking at what Treasurer Denoyer had this morning with the ARPA, the one of our answers, well, maybe we can put something together and push it toward ARPA to see if that's something we can do. And that may be, we haven't explored that option, but if there is very little pots of money to grab from, this just isn't a reality to have happen. And what I don't want to have happen is, okay, give everybody this raise, these supplements, and then take it away and start laying people off. Because we can't do that. We already have another looming issue that I need to bring up to the council, and I wanted to bring it up to health board, but definitely to the entire council, is this vaccination mandate that CMS has put out. This mandate basically states that your employees have to be vaccinated to the COVID vaccination. The way it reads now, you have until January 28th to start the process. The Supreme Court, this was in the Supreme Court. They threw it out last week for private organizations, but anybody that receives federal funding still has to comply by this mandate. So just like I had said yesterday in the task force meeting, and I had shared this with Skyla and Sherry and a couple other council members, that, you know, I have 11 employees roughly that are not vaccinated for COVID. 2 of them cannot receive it for a medical reason. So that leaves 9 employees. I had one give me a verbal resignation yesterday that he will not receive it. So he wants to leave gracefully. I have another one one of my supervisors who is a long-standing employee of RAS that is the same way. He is going to resign. These are 2 positions that I struggle to fill. I mean, they're 2 paramedic positions. You know, it's not like I have a bunch of people coming knocking at our door for jobs. We're starting an EMT class in February. Right now I have 14 people that potentially want to take the class. 9 of those have jobs already. So are they going to probably come work for me? Probably not. But I'm not going to deny them the ability to come take the EMT class. But just looking at that now, you know, I don't have a lot of people to grab from. I don't have a lot of people that are knocking at our door to come work for us. The people that will leave other EMS agencies are going to run into that same problem. They have to be vaccinated, and I can't force them to go get vaccinated. So my hands are kind of tied at this point. Like, what am I going to do? I can't say, okay, well, stay on and then lose the ability to bill to Medicare, Medicaid, what other federal programs there might be. I'll lose that ability. So in a way, it's kind of detrimental in saying, well, I'm going to lose their employees. I'm not going to be able to bill anyway because I'm not going to be able to leave the reservation to generate that revenue. But at the same token, if I keep those employees on, I'm not going to be able to bill anyway. So it's kind of a two-edged sword. No matter which way I go, I'm going to lose the ability to generate any more revenue from Medicare or Medicaid. Private insurance, you know, that might be another thing. But our private insurance makes up like less than 5% of our total revenue generated because we just don't have a lot of people that have private insurance. And the people that do have private insurance don't normally call for an ambulance. Or they don't give us their information. That's kind of the other things. They just don't give us their information. So one of the things when the tribe was asking for private insurance or to solicit private insurance, I stipulated that if we do it, we need to push that there is a ground ambulance fee that is able to be paid. Our current insurance now does not pay for really anything at all, but specifically, we still have to generate a bill. So if we picked up Dina, you know, and we transported Dina to the hospital, by law, we still have to generate a bill to her insurance because she has a third-party resource. So we generate that bill, but we never send a bill directly to the council, or the tribal members, but we write that up as a loss. So, you know, we may generate, just for example, we may generate about $1 million last year. And we probably wrote off about $3 million. So it's only about a third of what we put out that we actually generate back in. But that funds, you know, that pays for everything in the ambulance service with the exception of personnel. That pays for our GSA bills, medical supplies, you know, so anything that isn't personnel related, we have to pay out of third party. So, you know, we're always scrambling and pushing to make sure that we have our third party resources on the ball and that we're bringing it in. And, you know, luckily, like this year I said, we are doing a little bit better. We are generating more revenue. And I want to keep that flow going. But come 2 weeks, January 28th, if I don't have something to fix this, that's going to stop. It's going to have to stop. Because I'm not going to violate this mandate. And I can't, I mean, because that'll risk a lot of other, not just EMS, but other federal programs within the tribe. So there is no real answer. I don't expect you guys to give me an answer because you guys, there's not really much you guys can give me, but I think it's more just something to make you guys aware of.
Any questions for Eric? You know, ambulance service and our EMTs have always been paid low wages, and we don't appreciate them, you know, as much as we should be appreciating them, you know, for the service that they provide. I think at one time, the council did make some type of motion or attempt to increase their wages up there, but I don't think that
it went through, it was followed up on, so. But I do agree with EMTs and ambulance service getting some type of supplement over this pandemic, you know, for I consider them a frontline worker, so, you know, if there's anything that we can do as far as finding the money to give them that supplement would be, I'd like to support that idea. You know.
Speaking of what?
Got Pam and then Sharon and then Stephen.
And Donna.
And Donna.
I thought when,
Oh, okay.
I thought when we discussed this, Skylar had said that, health admin had that money. Do you have that money or?
And when I said it, it was, cause she had carryover, I had carryover, but somehow something got, I don't know if it was wrong or what, but I had carryover because everybody else had carryover. We're waiting for the loss reimbursement for ARPA, but council didn't approve it, and so we thought he had his money already, but that's that loss reimbursement, and I talked to the ARPA monitor, and he said he's waiting.
It was to scrape your dirt off. Hey.
So that's what we thought he had his.
Check out the bed.
Eileen, you're on. You need to be on mute. Eileen.
Also, then when we met this morning, we come to find out he didn't even get his 1.2 reimbursement from our company.
Early on in October or November, didn't your program receive a loss reimbursement?
Transfer allocation from the ARPA fund, though?
I gave him $1 million from health admin's loss reimbursement, and that's what I gave him, and that's currently sitting with the monitor still after I looked at it as a budget mom.
You haven't received it yet?
It's still sitting with the monitor
Yeah.
to go through.
And then he's getting another chunk, remember that came from the actual ARPA, that's 1.2, so that's what council needs to approve, I guess, is what we were told.
I think those are the same thing.
No, they're two different things. Two different.
Sharon and Stephen.
You mentioned insurance. If the tribal employee workforce adopted a health insurance plan, do you see that that would be helpful towards the ambulance service?
It would. I mean, our insurance reimburses a lot better than any federal program. And that's what most private EMS agencies do across the country. They do private insurance billing, and that's where a majority of their funds come from. So in that case, it's not a mandate per se from the private insurances. So we could probably squeak by in that case, but we just don't have that kind of base here to rely completely on private insurance. I mean, majority of our money our funds right now comes from Medicaid, from South Dakota Medicaid, and then Medicare, and then whatever's left over from any federal programs, such as VA or whatever there might be out there.
Just so I'm understanding you correctly, there's a mandate for any contractor that they work with for them to be able to build you as a contractor, your staff would have to be 100% vaccinated.
So the way that the mandate reads, it doesn't specifically state EMS or anything. I guess the best way to use this is like since we deliver patients into an emergency department, we are considered an adjacent employee of that facility.
Okay.
So for them to continue to receive their funds, they have to make sure that we're compliant with who comes in or who comes out of that, who's taking those people out. That also applies to like FedEx. FedEx has a lawsuit that's with the Department of Defense because the Department of Defense is holding them to that mandate as well, that if they have to have vaccinated employees for FedEx to enter that military base. That's still in litigation now, and I anticipate there'll probably be more like that because there's going to be a lot of private companies that are held to this same standard that they have to be mandated to be vaccinated their employees, and there's going to be a lot that aren't. So there probably will be more litigation, and this may get thrown out, but right now it is what it is, and if that changes in 6 months or 2 years, whatever, that's then, but right now that's what the mandate says, and we have to follow it.
So how are you managing that?
So, just during the lunch break here, your guys' lunch break, I had a meeting with our supervisors to deliver that message out to them. I had reached out to Native Command Consulting, our billing firm, our billing company, to get their opinion on this, just to make sure that I was going on that same avenue. And Dan Crew, the president of their company, basically reaffirmed what I had just said, that there's not really a workaround. We kind of explored the option, and we threw it out to the Denver CMS office, Region 7 office, about can we exert tribal immunity or tribal sovereignty against this. I haven't gotten an answer back. I anticipate hopefully within the next couple of days I'll get that. And if that's the case, then maybe it takes a resolution just to absolve us of that, or to put the tribe sovereign immunity against it. But talking with Dan a little bit more about it, and a couple other people that I kind of talked to about it, we don't think that's even going to be enough. CMS is going to say all or nothing. Either you do it or you don't do it. Because it's such a big issue nationwide that we don't, I mean, it might be something to explore, but I'm not going to cross my fingers on whether it will really hold any water with them.
How many, how many staff did you say you have that are not vaccinated?
11, and 2 will be able to apply for a medical waiver, so it'll leave 9 that potentially will either choose to get vaccinated before then or will resign. For sure, I know 2 employees have given me their verbal resignation with the anticipation that they'll give me a written one in the next couple of days.
Your total staff?
Total staff, EMS, dialysis drivers, minibus, and office staff, there's 47 of us currently, with 7 vacancies.
Thank you.
6 of those being EMT vacancy, and then 1 being a benefits coordinator that we've had advertised for almost a year now.
Thank you.
And we have Steven, Donna, and Russell.
Just real quick, I want to advocate also for Spotted Crisis Center.
They do not shut their doors. They take in children. They're a children's home. They got a month of hazard pay. They got no premium pay or no other funding allocations to them. So I do want to advocate for Jody and her team over there. What's fair for one is fair for all. And I think if we are talking frontline workers, they should also be defined as such, given their line of work. Thank you.
Donna?
Good afternoon. I'm in support of giving I guess all the 24/7, if they do their budgets and get them to budget and finance. And the ARPA. I've been to a couple ARPA meetings, but not being on the committee, we don't get a voice there. Or we don't get recognized, but I think that they need to get their budgets submitted. All the 24/7. Thank you.
Russell?
I guess the issue, like what I mentioned was, and again, Pam corrected it, was that particular resolution that was passed here was carryover funds from health admin. It didn't mention your $100,000 carryover, but there is a process that we have within this department, within the tribe, that if a program is requesting pay increases for their employees, there's a process for that. And it goes to budget and finance, and eventually it comes back to the chairman, and then it comes back to budget and finance with the signature. I mean, there is a process. And, it seemed like the program end up coming here asking us for raises, That should be internal, and a process that you have to follow. And I don't see why you can't use your $100,000 carryover to implement something like that may only last a year, but it just, we hear a lot here from, programs, and they think that with the snap of our fingers, we can make things happen. But over the years, I've been here for a while, and, ambulance service is always, that you guys always fall short. I mean, there was never enough funding for you guys over the years. It goes back many years too. There's no, and I think we're lucky now that we have a system in place to receive money back on some of your transports. And it's probably not up to standard either, but at least you're getting something back. And I know that there were previous employees of ambulance service that quit because their pay wasn't up to standard. They didn't get enough money, and they leave. But going back to this mandate, that's kind of troubling. It's almost like the other day I was watching this guy going to court in Australia because he's a professional tennis player, and he thought he could get away with not doing a vaccination. But their country decided, no, you got to abide by our rules and regulations, so you can't do what you're doing. It's like people hold us to some of these standards, and because they're in a chosen field, then, they probably think that they're indispensable, so they think they can get away with something like that. I mean, it's just like, we put ourselves in a rock and a hard place as programs and program leaders, and then at the last minute, then we come here to seek answers, and it's like we tie each other's hands and then they make a decision. I mean, that's kind of like the impression I'm getting right now, but she did answer my original question. That particular, I didn't see the motion or resolution because I was on the phone, and so I was just listening, hearing what took place at that particular meeting.
So I think in the late summer, early fall of 2020, I had shared an email with the administration and with the council about what was happening in Pine Ridge. So Pine Ridge Tribal EMS Department basically said, we're closing our doors, IHS come in and take over. And this was done over a weekend. We were reached out to and said, hey, can you guys come over, help us? We have absolutely no coverage right now. And we're short staffed. We said, we'll try to make something work. And we did, but we couldn't send anybody to help them. So right now IHS is running their EMS program. That happened, in Eagle Butte in the early 2000s. It happened in Belcourt in the late 2000s. So these EMS programs, at least within the Great Plains area, Rosebud and Sandy Rock, we're the last two. We're the last two 638 EMS programs that are still there. Crow Creek broke away, and they're all on their own, 100% funded by their tribe. Laurelville's the same way. Yankton, depends on Lake Andes. Flanger depends on the county in Flanger. So we are pretty unique in that we're holding on really tight to this program, and we don't want to let it go. But at the same token, if there is no funding, and it is over and over and over, and I don't really like to say this because it backsteps what I said when I was hired back into this position in 2018, that that this program should not be retroceded back to IHS, but digging deeper into it, it might be something to really explore. And that you don't know how much that cuts me to say that, to really say that this program, because I've put sweat and tears. I mean, Steve can attest to that. I worked under Steve for years before he left the ambulance service. I mean, I've put my entire adulthood into this program. I've been with this program since I was 18 years old. I went to college, returned back to work for this program, and I've been here since then. And I've always pushed hard to say that this never can happen. We need to work hard to make this program succeed. And we have. I mean, I'm not saying that we haven't made this program succeed, but we haven't made this program succeed in the way that we can financially be sustainable on our own. 638 in this program was done in, you know, the late 80s, and it's been going since then. And I'm sure, you know, Steve can attest to this. I mean, it's been a struggle. It's been a struggle every year, and it's not getting any better. I mean, our third-party increases, the cost of living, cost of medical equipment, cost of our fleet, everything raises at the same time, if not more than what we can achieve. Will IHS do a better job with this EMS than we will? I don't know. Right now, they're paying a huge amount to contractor EMS program to supply their staffing, and that's, you know, that's sufficing for now. But what I think about when I hear how much they're putting out to this contract company, it just astonishes me that they can find this money to do this, but yet not support the tribal EMS programs. I mean, they're putting out 3-4 times the amount of money to keep this program working in Pine Ridge, in Eagle Butte, in Belcourt, but they won't dump that into the tribal programs. And that being said, I don't know. So that is something that I will propose that needs to be thought about. Is maybe that the exploration of retroceding this program back to IHS needs to be really looked into. Personally, I would say I don't want that to happen. Like I said, I spent basically my entire adulthood in this program trying to make it work, and it's just not getting any better. Every year it's the same problem, if not worse, and we're deeper and deeper into debt every year because of it. And now we're to the point where if we have to lose employees, you know, we may not be able to function. There may be a time that you call for an ambulance and we don't have anybody available. And, you know, we've always strived to not reach that. You know, some of these two employees that are handing me basically gave me their verbal resignation. You know, I've known them for well over 15 years, each and every one of them. And for them to tell me that, it cuts me, but I'm like, I have to be the bigger person and understand that I have to protect this program. But they are long-standing employees. They're non-tribal members. But in my mind, that never matters. I mean, our non-tribal members are the reason why our EMS program keeps going. We've struggled hard to get local EMS people here. And just like Russell said, our pay is really bad. So it's hard to keep people here because of that, when they can go work somewhere else and get paid more. You know, we've been doing the hazard pay. We've tried to make things a little bit easier for our employees by, you know, building the addition to our building so they had somewhere to rest in between calls. You know, we've tried to do small things to boost morale, and I think it worked in some way, but we've had a lot of dedicated employees that have stayed with us, even with the way our pay is. You know, I think I have more than half of our employees are 8-hour annual leave earners, meaning that they worked for the tribe for more than 10 years. And I'm always proud about that, because I'm like, I've had a core group of employees that have stayed with this program for 10 plus years. And yes, they've complained and gone back and forth, but they've always come to work and showed up and did the job. And I've told every one of them, that's all I can ask of you. I don't ask you to go any more than that. If you come, do the job, and you return the next week, that's and a lot of them go above and beyond that all the time. When we have short staff, hey, I got a core group of people I can call. Hey, I need somebody to cover tonight or today, or, you know, I have so-and-so that's sick, can you come in and help cover? And they're there. Some of them, can't make it, but there's always a group of employees they're gonna come help. The two that are resigning, they're some of my most dedicated people that I can call on, but they're gonna stick to their guns and hold their beliefs about the vaccination, and I can't change that. So, there is a lot of that goes into our EMS program. There's a lot of facets to it.
Eric, Russell had a comment and a question for you.
I didn't want to interrupt your speech here, but, one of the things you mentioned was, some of these other tribes that they're self-sufficient, which is understandable. Some are in a better position with their casinos and treaty obligation or repayments of settlements that they got. But you also mentioned, and maybe I'm hearing it wrong, but I'm hearing now that Indian Health Service, maybe Aberdeen area, is throwing a lot of money into the ones that Indian Health Service took over. Is that what you're saying?
So that's kind of yes, that's what I'm saying, but that's also an industry-wide thing. I mean, healthcare in general has put a lot of money into contractors. Kelly can attest to the contract nursing. There's tons of people that are leaving hospital-based facilities to leave to go be a contractor because they can make more money at it. And that's the exact same thing with EMS. X-ray technicians, lab, I mean, they're leaving their jobs to go work for contract companies and do the exact same job that they were doing before.
Okay, and the point I'm trying to make here is, and how many letters have we written to I don't know if it's area office?
So we write one every year, at least twice a year. Once about in mid-year, so March, and then usually around September. This last 2 years, I will say that we haven't wrote one because we were told from the get-go that there is just no money to be had. So
But then yet you're saying they're kicking money into other areas. I mean, if that's all documented, I think, we just won a major case against Indian Health Service. And so maybe it's time that we divert this to our lawyers. Maybe it's something we need to do again against Indian Health Service.
So
I don't want to talk the legal stuff here with us being on TV, and I think we really like it when we're on TV. But that's something that we should seriously look at. Certainly our people don't want to lose our ambulance service, and we don't either. I mean, I don't. Speak for myself here, but we come a long way getting ourselves established here on the Rosebud. But it's been a struggle every year. I mean, I don't know how many times you had to take carryovers from different health departments to keep you afloat. It's probably a yearly thing.
Every year.
But maybe it's time we take some kind of action. I'm not going to pursue this any further than what it is, but I like your comments. It is what it is. It must be a health saying. But the last time I heard that was, I told my Kala Ben, I said, I think we're gonna end up in jail, standing in that front line at Dapple. And here he told me, he said, it is what it is. And I got thrown in jail. I don't want to relive that, but gotta go have a drink.
Eric, you have any more?
No, I don't have any, unless there's questions.
Thank you for
You said it earlier.
speaking and answering our questions. Also, are there any more questions for the task force?
Yeah.
I have one more, Chairman.
Go ahead, Donna.
I think if we do have a lot of unvaccinated workers, that's another issue, especially in our 24/7 programs. And I think the directors need to work with them and see what I don't know. It's an issue. Thank you.
Okay. Anybody else? Dina, do you wanna talk about your program and what you do?
So last week, when task force did come down here, I did approach council to request, hazard pay for my staff. So with my program, we are frontline workers. We do work with positive relatives. And we do the food deliveries, we do home visits. We are out in the field every day, even on weekends. So the staff that I do have, they are frontline workers. And besides working on weekends, we also have an evening person that, you know, comes on from 3 to 11. We also have a weekend worker that works from 11:30 to 11:30 at night, Saturday and Sunday, just to take care of the ER transports. Sometimes we have issues because my evening person gets sick now and then, so that kind of we struggle to have someone come in and for his shift. But we've been doing this for 2 years. The hazard pay did stop for our workers in March, and we continue to do this. We continue to serve our relatives who are positive COVID, and we're still doing it to this day. So last week I did ask council to approve hazard or premium pay for my staff, and I do have carryover in my budget. I know that CHR, we've had a high turnover rate because of the pay scale is so low. When I started as a director for CHR, our pay was like $7. And right now I've been able to kick it up to $12. And hopefully in the future, I'll be able to kick it up even more. But when I came here last week to ask for hazard pay for my staff, I also requested a $2 raise for my staff, because I've been trying to get on budget and finance to give them a $2 raise that I promised my staff that I would give them back in May, and it's January right now, so it's 8 months. And we were able to get into budget and finance one time, and there was a form that wasn't the correct form, so we had to go back and correct that form. And then since then we've been waiting to get back into budget and finance. So we do have the funding to support that supplement, but that's what I asked for last week on council, was either bypass that budget and finance to give my staff that $2 raise, or, you know, and plus hazard pay. But what I'm saying right now is we do work with,
You know, there's
positives.
no hazard pay anymore. It's not considered hazard pay. That was under the CARES money. They were calling it hazard pay. Premium pay is only for in shelter in place and you're an essential employee and work between that time that you were essential and you had to work because of the shelter in place. So now we're calling it supplemental. So.
So I did, well then last week then would be referred to supplement pay.
And you were under that motion that
Yes.
that would be, and you would
Yes.
be, it was directed that it would come out of your carryover. So
Yes.
if you do got that, it's already been, motion has been made to do that. So all you would have to do is do the A's and make that adjustment.
Okay. Now that's retro back to October 1st, is that correct?
That's what the motion was.
Okay.
Yep.
So then the $2 raise for my staff, I just wait for budget finance.
Well, that would be your raise, your supplemental pay, right?
It originally was going to start as the $2 raise. That was the motion that I wanted to bring forth.
Okay.
Because I didn't want to open the
Can of
can of
worms, yeah.
worms that hazard pay, supplemental pay brings. But, there was a motion made for supplemental pay.
It's open already because they're listening to us out there and they're already texting me saying, am I considered frontline? And it's programs that probably are not considered frontline, but they're gonna ask for it anyway. And that's how it's gonna be, you know, so it's either abide by the motion and go by the motion and honor the motion that was made, and that was allowed to give you the supplemental increase in for your workers, so. The raise would probably have to go through budget finance,
Okay.
okay?
And that supplemental would just be, with the time period on that?
Right.
Okay. So when we do the food deliveries, there's a process in place, and the process is we receive the paperwork from the contact tracers. Once we receive that paperwork, then we do our own paperwork, because it's about accountability. We have to make sure that we have the food card with the number to the person that's positive, and also for non-household members. So we have to do our part, and then we go ahead and do the delivery of the food cards and the cleaning supplies to the positive person and the non-household contacts. During the 10-day quarantine, we do a two-time visit in their homes. So within that 10 days, they'll get a visit twice. It ain't gonna be like, there's no set time within that 10 days. It's just 2 times home visits. When the person is not home, we have a non-contact, and on that contact, we put it on the door, or we try to put it on the fence, or maybe a car, because sometimes they have dogs. My staff's been bitten by dogs. So we try to place that non-contact form wherever we can. But it's usually, we usually have a couple of them. And then there's times where we might not be able to find the person because the direction is wrong, or they don't answer their phones. So then we try to make another attempt to go back out. Any extra food cards or cleaning supplies comes from Skyla as a directive.
Sure, question, comment?
Yes, comment. I wanted to, find it here. I wanted to bring up some clarification for the COVID cards. Yesterday during the task force meeting, we adopted a different protocol for the food cards. Because there were some families that had a lot of people sheltering in place, and the $200 card wasn't going very far. So for a family of 4, you get $200 food card. For a family of 6, $300, and a family of 8, $400. So basically, for every 2 people in the house, there's $100. So I just wanted to put that out there because I know a lot of council reps were getting that complaint. Well, if there's 3 positives in the house, does that mean all 3 get the card? No, it doesn't. However many your household is assessed by, that's how many cards that household will get. I also want to mention that these food cards, if the people don't have somebody to go shop for them, CHR does volunteer and do the shopping for them. These food cards are a big issue. I also want the public listening to know, I didn't know we were on air because the screen's not on. I want the public to know that our resources may run out. So I really want you all to know that we don't know how long we'll be able to offer food cards to assist people to continue to shelter in place. So just prepare for that at the rate that we're going. And so with our relatives out east, we had some issues where some of them, because when we go out, we would ask them if they had a family member that can do their shopping, and some of them would tell us yes, But in the end, apparently it became some issues where they didn't have gas money to do their shopping. So now any of our relatives out east, we ask them if, to give us a grocery list, and then we usually do the groceries and then take it to them. So that was something that came about here just recently. So we made some adjustments. So with our program, you know, when things don't work out, then we're always adjusting our services.
Question for CHR? Go ahead, Sharon.
I guess, what do you do in an instance where, because I know, when you don't like have contact with someone for all the reasons that you brought up, what do you do in that instance? I know you mentioned prior at a meeting that we had, a closed meeting that we had for, the task force, that you mentioned that you would possibly like to be able to issue citations for people breaking quarantine. Is that something that you still are interested in doing? So I did bring that up to my staff, but that discussion didn't get anywhere with the staff. We still, again, like I said, leave the no contact, and we still contact the tracers to let them know that they weren't home at the time when they're there, as well as law enforcement, because we have that authority that Skyla gave us to call law enforcement when they're not home. Because when they're in quarantine, they should be at home.
Is there anything else? Nina?
One thing that we noticed too, is that we're having a lot of our relatives being repeated positive. So hopefully in the future, you know, they take precautions, you know, wearing the mask, you know, hand sanitizer. But just be careful out there. Like I said, we're seeing people that are being on our list like 2 times, 3 times during a short period, like within 4 months or so. So it's still the person's responsibility to take care of themselves and take care of their family members. And, you know, like earlier was mentioned, you know, our little children, we need to make sure we protect them, because some of them can't be vaccinated.
Okay, any more? Not, thank you, Nina.
Thank you.
For giving your report. Any questions for the task force? Russell?
I don't have any questions, but, you know, from this time forward, I know we passed a motion, was referred back to resolution. What procedures are we gonna, you know, and the question was asked, you know, about shelter in place versus lockdown, those kind of things. Are we gonna get into some discussion about that and leave out of here, at least have an understanding among ourselves what's gonna take place? If not, I'm gonna go.
I just, Steven just showed me the procedures and stuff for shelter in place, the process for that, so I'm gonna go through that, and we're gonna look at it, maybe try to revamp stuff with the task force. What I really need is, like, for health admin, Skyla, if somebody can write up something that I can do a PSA over with the changes that we made for quarantine and isolation, how many days and what that consists of, how long does it take for somebody to show up at your house within so much time, so that people will know that they are coming, but it just takes some time. Also, how long it would take for them to get their supplies, if they're going to get supplies, and anything new that I can use as far as a PSA, that the questions that are being asked out there in the public to council people and myself. So I'm getting calls, I get messages every day on Messenger, Facebook Messenger, or even text messages asking me the policy. So what I do is I call Skyla, here's the number, please call this person back, and she does do that. So it's just a matter of time. There's so many people out there that have the COVID that are active right now. It's hard to get to everybody, so I think it would be of great interest for us to get that process in place so I can put it on a PSA. Okay? You can do that right away. I can do that right away myself. Okay? Russell?
Yes, as far as the process too, and I guess I'll have to ask you, do you have staff people in there that answer the phone?
I got 3 staff over there that come back.
So your phone is, when it's ringing, people actually answer and talk to people?
Yep, and then sometimes, you know, like the vaccine, we got overwhelmed, but now that it whittled down, now that the lines are open.
Okay, and then
The
do you
tracer
have,
one.
do you have on-call workers that, you know, like housing, you
Yeah.
hear that every, you know, during the weekend, so-and-so is on-call worker, call this number. Do you have that kind of?
For the health administration itself, no, but at the tracers, they're supposed to have that.
Okay, can you also include that in your PSA?
Yeah, that and the amount of time is when you come off isolation or quarantine, how soon do they get their letters so they can return back to work? Because that's been another question as far as going back and using their own leave after they've been taken off isolation or quarantine. So that's another question. How soon do they get their letters of release after they're released? How soon they can get their letters and when to expect their, how long it will take anyway. If you can put that on there too, and I can put that on PSA. Okay?
Okay.
Okay. Is there anything else for task force? Sheriff, Pam, and then Dina.
Thank you. I think one thing that Shorty updated us on yesterday, I don't know if you went over it, except Milk's Camp, all of the trailers have water and sewer now. I thought that was important for you all to know, and I wanted to ask all of the council members that are here, if you could check on your COVID trailers and make sure that they have furniture, and just get back to Skyla or I and let us know so we can make sure that those trailers are all taken care of.
I guess, going to the questions of the letters, who, is that your office that writes those, Skyla? And so, when you guys get names and what day that they've been put on quarantine, is it there an automatic letter generated ready for them?
Yeah.
Or do you guys wait until the actual day and then print the letter?
Well, what we're trying to do is so, like let's say I'm positive yesterday, it'll be 10 days from that date will be there, but we try to get it ready, but then we were trying to not release those letters until you finish the whole entirety of your isolation and quarantine. But it's getting like, people are like wanting it now, and because of the timesheet. And what's happening with HR is that since I won't get my letter till I'm in quarantine, but timesheets are, end of timesheet is today, and they go in tomorrow at 10. But then I won't get my letter till I'm done isolating. So what HR does is she'll take my sick leave, then when I get that letter, then she'll reinstate my sick leave, because she'll give me COVID leave, but people are wanting it, so we're developing 2 letters, one to end today, then we'll do another one to cover the other dates. So we're supposed to initially give those letters at the end.
Chairman, is that the direction that you have personnel department doing? Is, I mean, is there any integrity?
They can't give them COVID leave unless they actually, once they're off quarantine and stuff, when they let go, they can't give them any, they have to use their own leave until they get that letter.
But what I'm saying is where's that in black and white for our?
That's what I'm asking for. So I need to know that so she can write it down. So I do in a PSA, we have a process of doing that. So from step 1, when you get COVID, when you go in isolation quarantine, how long is that?
What's expected to, as long as somebody to come check on you, to give you a call, to give you your food card or your cleaning supplies or whatever you need, how long does that take? And then when you come off quarantine, how long do you expect to get before you get your letter to say that you're off of quarantine or isolation for the job place?
Now, I remember hearing sometime in one of these meetings, Skyla mentioned that, that somebody's doing a spreadsheet of these. Yep. Of names and what day they come off. Yep. That they're supposed to. How come that spreadsheet's just not sent to HR so that they know that those are the ones that are on isolation for the employees? And I think that'd be a lot easier than having them generate 2 different letters. But also is, I think we need to do this across all of our tribal entities, even our chartered, just because some of the chartered have some different policy written for it. And another question I had was, the ones that are doing, okay, so we're doing 10 days. Have you come across anybody that on day 10 or day 11 that they're still testing positive? So you guys are just extending them how many more days?
Yeah, so what we did was we had Jane go, she started, but then she did her full isolation, but even though she did her full 10 days, she's still positive. So we extended another, what is that, 5 days? Oh, we don't know that happened, but 5 days.
Another 5 days, so maybe there's a possibility of 15 days of quarantine isolation.
That's the reason why we don't give letters early, because there's hard counting that you won't successfully be, after 10 days or whatever, you'd be negative. You could still be positive after 10 days, so that's why we don't give the letters early.
Thank you.
Jordan?
I just had a question about that. So I thought the antibodies can stay in your system for up to 90 days, so you can continue to test positive for that time. So how does that work? Because they can't, like SWA, we sit on that board, right? And they use their own leave no matter what. They don't have it anymore. So if they continue to test positive, they're going to be out they could be out 3 months. So can you guys clarify that? Because I don't feel like if we're going to be testing that amount of time, then they're going to still, they might be able to test positive still. It's not fair for them if it's just an antibody in there.
That's something that I run into. I have a relative that works. She's a cook, and she got COVID, but she's feeling the after effects. That she's no longer testing positive, but it really drug her down, and she's still having a hard time getting around. She can't go back to work, but there's some time or another where she has to start taking her own leave, and that's time that they said that she didn't have COVID anymore. So basically after that, no matter, having the long-term effects is a problem too, so that might need to be addressed.
I guess I was just referring to the testing, because they can still test negative or test positive.
Right.
So I can still test positive, but I can show no symptoms.
Yeah, okay. Yeah.
So CDC guidance and what we follow at the hospital is if somebody tests positive for COVID, we do the 5-day isolation. Like I said, through the drive-through, we let them know they should do the 10 days based on the recommendations from the tribe. After their isolation of 5 days, if they're feeling better or no symptoms are better, they can return to work and wear a mask at N95 for the other 5 days. At the end of 10 days isolation, if they needed to stay home for those 10 days, that's fine. But we do not retest after 10 days because of that fact of the 90 days. And we continue to constantly wear a mask, hand hygiene, and isolate the
So I guess why do they test again if, you see what I'm saying? Why do they test again if they're already positive? Then I guess I'm not understanding that.
So I think and I'm not speaking for Kelly, but I think what Kelly wants, she just wants to be in this. And there's always been a debate on, should we test after you're positive? And no, you shouldn't. That guidance shouldn't be there to test to make sure you can come back to work. Just because of what Jordan says, that 90 days, you can show a positive for 90 days. It should be more based on whether you're symptomatic.
Thank you, I just.
So, and that's not something that's ever been really pushed, and I think that's always been kind of a looming thing that we try to say, this is what needs to be done. But quite honestly, it's come down to just, that's what people want. People to appease people, and that's what a lot of this comes down to being. People want to have that test. Because yeah, after 10 days, some of them, they don't show positive anymore. So then they get that reassurance that I'm no longer positive. I can go out and go back to work, go back to public, go back out into the public. And that's a false reassurance, I guess is the best way to put it. Because you can show positive. Like I can have COVID today, 10 days from now, well, since I'm essential, it'll be 5 days, but I have to wear a mask. I'm gonna wear a mask anyway. So after 10 days, I test, I show positive. Day 20, I test, I show positive, but I'm not symptomatic. Maybe I was not symptomatic after day 5, so I'm gonna come back to work. So it can go that way. And the same thing with the 10 days. After 10 days, you know, you could be non-symptomatic but show a positive test. So it should be more based on if you're symptomatic, not on a test that will say you're negative.
Thank you, I just wanted that clarification for her.
Yeah, and we've been noticing through the drive-through testing that we're getting a lot of people that return each day to be tested for that fact. And so we're having to do a projection and look how many tests we're doing a day and how much our supply consists of. So, yeah, Eric's exactly right. In CDC, you shouldn't retest. So,
thank you.
Yeah.
So if you guys know that there are people that are constantly coming back every day to retest, how come you guys haven't said, no, we're not going to give you a test because you was here yesterday asking for a test?
Quite honestly, that's really hard to do. That's really hard to tell somebody, no, you can't test. I know it should be the way it is, but it's much simpler just to give them a test and then let them go on their way than to say no, because then it turns into a big argument of why don't you want to take my test? I'm going to call Pam and I'm going to complain because I didn't get a test. I was denied services when that's not the case. It's much easier to say, all right, I'm going to test you, go along the way. And that's what, you know, Kelly and I were talking this morning. That's what more people are seeing, that they're coming back day after day to test and they keep showing positive. So my concern with that is okay, if you're showing positive, is that counted as a new positive for that day, or is that, you know, going back and forth? But they've identified that to say, okay, you're positive yesterday and now you're positive again today. We're not going to count that as a new positive because you're already positive. You know, we're not going to change that. So to get back to your question, yeah, it's just much easier just to give people a test and send them along their way than to argue with them. And I know that's probably not the answer you want to hear, but I'm one of those people that I just want to be truthful. I don't want to skate around it and just, but that's honestly what it is. It's just to get people, to make people happy and to appease them.
So if I came in day 1, day 2, both positive, why day 3 I come through, you guys gonna let me test again? I mean, why couldn't the straight answer just be, you know, you came in 2 days in a row, there's day 3, you're gonna be positive. It don't matter because you're in a 90-day era of being positive. You might not have symptoms, but you're gonna be positive. I mean, I think if somebody explained that to them, I think it would help, rather than say, oh, okay, I'm negative, but I kind of got a stuffy nose or I got an itchy throat. Okay, well, maybe you test negative, maybe you need to go in for a flu, or maybe you need to get strep checked. You know, those are some options that, you know, should be at least talked to with them, rather than just say, you're negative, see you later, and move on to the next car. I know that sounds like it's petty in some way, but at the same time, those are some assurances that people need. And because you guys are in that medical field, they're gonna take that word. I don't know, just my thought, my thinking, I guess. Thank you.
Sure.
Thank you. Yesterday, the task force had some recommendations that they wanted to make to the Itancha Intertribal Council. And one of them was regarding the leave issue. Because it's such a process, we wanted to make the recommendation that you reconsider what is it called? What's the form called? Special leave request form? That doesn't be a requirement for those with COVID, and that the HR department accepts the initial positive test result as that they are COVID positive. So those are two of the recommendations that the task force had. Did I forget anything, Skylar?
The mandate for testing if you're not. The mandate if you're vaccinated, and if you choose not to be vaccinated, then you be tested weekly. That was the other one that we made.
That was another recommendation that we made. And then there was one regarding leave. If a person chooses not to get vaccinated, we're recommending that they cannot utilize COVID leave, that they have to use their own personal leave. However, if they are vaccinated, that they can use COVID leave. However, I do want to mention to council that Councilwoman White brought up a good question when she asked if we're going to be able to continue to provide COVID leave, because through the CARES funding, when you look at the budget, we spent $80 million in COVID. So is that something that we're going to be able to continue to offer? Because if we don't offer it, and the programs have to offer it, do the programs have it in the budget to offer that separate line of leave? So that's something that we need to discuss.
Any other questions? Russell?
Yeah, how flexible are we in terms of, I know the Indian Health Service has that HIPAA law. How does that apply to us? You know, sharing information among our programs.
I guess that's a question for Skylar or one of the health officials. I guess I'm not sure if I can even give a name out as far as people who are vaccinated or not vaccinated. I don't know if that's...
That information is confidential.
It's supposed to be, but it, you know, let's say an employee doesn't show up for work right away, you know, you're on COVID leave. I mean, somebody will say that. I mean, how do we handle that as a tribe?
Well, they notified me from, as far as, I know that they're positive as far as what I do, and the timekeepers, HR knows if they're positive or not, if they're on COVID leave.
You know, example is, last week, I think it was, finance was going through a deep cleaning. They were going to be shut down for that afternoon. So the personnel, probably in finance, know who this individual is, because that person probably didn't come to work. And then, of course, it gets on Facebook.
Yeah.
And, you know the history. How do we protect individuals from the HIPAA law?
How does that process go right now, Skylar, as far as being reported to who? And I know the chief of police administrator is notified when there's positives out there, so he can enforce them being at home if they leave. How does that work now?
So how we've been dealing with that is that it's not that I get accused of not sharing the information adequately, but HIPAA is a law and we're not above that law. And so like Russell said, how do you keep from throwing your employees out there? And we all know each other's business around here, but still, you know, let that be their business. But what I do, like for an example for my office, is if someone is out on COVID leave or just regular leave, sick leave, and you call my office and ask for me, or the reception answers, I always tell them that I don't want to ever hear them say on the phone, oh, she's out on COVID leave, or she's got COVID and she's not here. The protocol is she's out of the office and she'll return this date. End the story. So that's kind of the protocol that should be practiced, but we don't, because
When
we
they
know
bring
each
that,
other.
when they bring that letter back in, basically then they'll get compensated for then they will be changed to COVID leave from those items. Right now, I get reports that, oh, in this program, someone tested positive. They don't give me names, they just tell me there's somebody that tested positive in the program because they report it to their director. And so then we go up and do cleaning and stuff, but they never give me the names. They always just give me a number. So,
Yeah, and they're pretty good about, keeping that information confidential. Cause by all means, it has to do with their livelihood, such as their paychecks.
yeah.
So that's kind of how we've been dealing with it, and, I mean, it's a tough situation.
Did that answer your question, Russell, or way off?
You guys are way off.
Can I respond?
Yeah, go ahead, sure.
Okay, thank you. Thank you for your question, Russell. I want to refer council to 45 CFR 164.512B. It says the HIPAA law privacy rule recognizes the legitimate need for public health authorities and others responsible for ensuring public health and safety to have access to protected health information to carry out their public health mission. The rule does recognize that the public health reports made by covered entities are an important means of identifying threats to the health and safety of the public at large, as well as individuals. Accordingly, the rule permits that covered entities to disclose protected health information without authorization for specific public health purposes. And then it goes down the list, it's really long. So we can disclose that according to the 45. We can share within our entity this information. I'll email this out to everybody. And Lloyd did give a determination on this last year under President Bordeaux's administration.
Thank you.
Any more questions for the task force? Not, I think we're done. We'll try to get more PSAs out, explaining the processes of what they expect when they get COVID or get put in isolation or quarantine, how long the letters take to get to them, how long it's going to take to get them their supplies, their food cards. So we'll try to get that out in a PSA, okay?
Big task force, thank you, Kelly.
Need a motion to adjourn.
Skylar.
Rick.
Donna.
Question by Pam. Question by
Donna.
Donna. All in favor, adjourning.
1, 2, 3, 4, 5.
Thank you.
5.
Online. Eileen.
I'm gonna do that.
Yes.
Bill.
Yes.
Stan.
Thank you, Eric.
Micah.
Yes.
Donna.
Yes.
Neil.
Yes.
11.
Opposed.
0.
Not voting.
2.
Motion carried. We're adjourned.
3.
Our next meeting is on our casino meeting, is it? On the 26th?
6.